And I'm really thankful. I can't say anything more that you have taken. Ideally, we should be doing, but we are just a staff of 5 people, and I think joining hands is the only way to take this program forward. As you know, we have a group of NGOs. We have almost 150 NGOs who work with us, and we work through them and give them our ideas, and they share with us their platforms and their members. Also, we are recently working with Mumbai Trust, Project Mumbai, and they have started a different yojana saying Ghar Ghar Mein Donor. So they will go to each society and give this concept of organ donation. And as very rightly said by Dr. Archana, that even I 100% believe that it is the doctors whom we are not aware of organ donation, and hence we are not able to guide. In fact, it is very amazing that a lay person or even a unskilled person or a skilled laborer for that matter, when explained the concept of organ donation in the moment of grief, they agree to donate, but we don't know it. I think it's not included in our curriculum. Dr. Kamakshi Bhatt is here and Akash is here, and through them we are starting for the last 2-3 years. She is taking classes for anatomy students to so that it comes somehow they come to know this concept. So without taking much time, I really appreciate your involvement, and I'm really happy that we could get in touch with you. Rather, you could get in touch with us and take this idea forward. Thank you very much, and all the best for this program. And hope I can participate more actively next time. Thanks.
Yes,
Thank you so much, madam. We surely assure you that we will do our level best, because IMA has got a reach in nook and corner of Maharashtra. So we can surely take this program forward in a very, very, together we can do a lot of things in entire Maharashtra.
Yes, thank you, madam. We all together will forward this organ donation movement all over the Maharashtra and the India to make more people aware of this donation campaigning. Now we will start immediately the scientific session. I request Patel madam to continue the sessions.
Okay, so I'll just, yes, okay. So starting with our scientific program, we have our first speaker over here, Dr. Akash Shukla, who's a very dear colleague and a friend. And a warm welcome to you, Dr. Akash, on this session. And to introduce our speaker for the day and for starting the first session, which is overview of organ donation, working of Roto Soto Noto in India with transplant laws. I invite the chairperson, Dr. Vijay Shivpuje, who's a consultant trauma and acute care surgeon at Yashodhara Super Speciality Hospital, Solapur. Dr. Shivpuje, please take over. Please introduce the speaker and start with the session. Dr. Shivpuje, you are the host. You are the co-host. You should be able to. Okay, not yet. I'll make you co-host. Yes, so you should be able to unmute yourself.
Dr. Archana, I request you to introduce Dr. Akash Shukla very well, because I don't have as much information about him. But welcome, Dr. Akash Shukla, and I request Dr. Archana ma'am to introduce you.
Okay, so allow me to share my screen. I'm very, very happy to introduce Dr. Akash Shukla, who is MD DM Gastroenterology, EPG DHA from TISS, Fellowship in Transplant from Barcelona and Pittsburgh. He's Professor and Head of Gastroenterology at KEM Hospital, Director and Consultant Hepatologist at Sir H.N. Reliance Foundation Hospital. He is Joint Secretary at ZTCC and Joint Director in charge at Roto Soto. Governing Council member of INASL. He is member of Steering Committee Valdic EASL Europe. He is the first non-European on the committee. Experience of over 500 liver transplant. He has 86 research papers, 8 chapters in textbooks, and editor of 2 textbooks to his name. So a warm welcome to you, Dr. Akash, on this session, and I kindly request you to please start with your session.
Thank you, Dr. Archana, for those kind words of introduction, and it's good to see you.
Yes.
And thank you, IMA, for having me today. Can I just request you to allow me to share?
Akash, you are the co-host. You should be able to share.
Yeah. Now I can.
Yes, it's
Are my
seen.
slides visible
Yes,
now?
yes, it is seen.
Okay, great. So in the next 20 minutes or so, I'll be taking you through what is the role of the ZTCCs, the SOTO, ROTO, and the NOTO, and how do we work with the laws that are there. And we will also, and then I'll leave a lot of time for the discussion and question and answer, because I'm sure there'll be a lot of questions related to this. So rather than boring you with the theory, I'll give a broad overview and then leave time for discussion. So Maharashtra was one of the first states to adopt the Transplantation of Human Organ Act. It was enforced in Maharashtra in 1995, within a year of its enactment by the central government. The DHS was appointed as the state appropriate authority, and the GMER was in charge of the state authorization committee. So the state authorization committee is the committee which approves transplants for living donor transplants, and for every center that is doing less than 25 transplants a year, the approval has to be got for living donor transplant from this state authorization committee. Or if there is a donation from not an immediate relative, then also the state authorization committee is the one which will approve all the transplants. Now, Maharashtra government recognized the institutions and the brain death committees, and they issued the state guidelines to implement the deceased donor organ transplantation almost 22 years ago. These guidelines have now just been updated in the last 1 year, where we have worked actively so that we can have now common organ allocation guidelines across the whole state, across all the regions of Maharashtra, and now they are being implemented in the very, very near future. So this is the original government GR for the formation of organ distribution systems, including the MACFOT and the ZTCCs. And in the 1999 year, the first meeting was held for MACFOT, and 4 ZTCCs were formed: the Mumbai, Pune, Nagpur, and Aurangabad. And now we also have a proposal to increase the number of ZTCCs to almost 8 across the state. Now we also have the NOTO, ROTO, and the SOTO. So while MACFOT is the supervisory body for all the bodies in the state, NOTO is the supervisory body for the country, ROTO for the region, SOTO for the state. Now DHS is overall responsible for the state of Maharashtra, and all the ZTCCs report to that. All the hospitals are registered with the respective ZTCCs. Now, who form the members of ZTCCs? The administrative heads of the registered transplant hospitals, representatives of the state appropriate authority, state authorization committee, NGOs and journalists, and subject experts who form the different subcommittees of different organs. And you also have transplant coordinators and intensivists. All these comprise the ZTCC. What does it work for? It maintains the common waiting list. It is also responsible for distribution of the organ according to the guidelines for the particular city. It also coordinates all the activities for procurement of organs in the city, and spread awareness programs for the professionals as well as public to promote cadaver transplants, again in their particular region only. The patients are listed through a particular hospital which is registered and recognized for the transplant. There are no direct registrations with ZTCC, and the patient can get registered only from one hospital in a particular state, and this is the duty of the SOTO. The list is updated and sent to the different hospitals. When we distribute the organs, the first priority goes to the donor hospital, then to the city, then to the other cities in Maharashtra with the help of SOTO. So if one ZTCC doesn't have an appropriate recipient for the organ, then it is offered to the other ZTCCs in the state. If there is no suitable recipient in the state, then ROTO helps in distributing this organ to the adjacent states which are part of the ROTO, and that is the duty of the ROTO. And if in the region also there is no appropriate recipient, then we offer this organ to the rest of the country with the help of the NOTO. So that brings us to the important functioning of ROTO and SOTO, the regional and the state organ and tissue transplant organization. So this is right now situated at KEM Hospital, Mumbai. The SOTO and ROTO came into being because of this modification to the TOHA in 2014, where it was mandated that there should be national, regional, and state human organs and tissue removal and storage networks. And this was in order to facilitate a national registry of donors and recipients of human organs and tissues. And while ZTCCs are restricted to only deceased donor transplants, the SOTO, ROTO, and the NOTO are also mandated to supervise living donor transplantation. So this is the structure. We have one DGHS, which is the apex body for the country, Director General Health Services. They have NOTO to help them. The NOTO has the 4 ROTOs to help them, and each ROTO has several SOTOs to help them. And then these SOTOs may have certain other bodies below them which may be helping out. For example, ZTCCs in Maharashtra are part of the SOTO. So in ROTO West, we have these 7 states: Maharashtra, Madhya Pradesh, Chhattisgarh, Gujarat, Goa, Daman and Diu, and Dadra and Nagar Haveli. What does the ROTO do? It monitors and does a surveillance of transplant activities in the whole region, that is these states. It collects the different statistics from the SOTOs and maintains a data bank about the transplants and the donor registry. Also, it operates various schemes to promote organ donation, donor health check-up, and safeguarding of the population across the 7 states. They also conduct training programs for the region and create awareness for deceased organ and tissue donation. They also form advocacy workshops for the region and the state and have an important role in dissemination of information and providing technical guidance and support to the new SOTOs that are coming up and handholding them to achieve their goals. What does the SOTO do? The SOTO has got a very important operational work. So while ROTO does more of a policy work and coordination work, SOTO is a more hands-on organization. It is responsible for maintaining the waiting list of all the patients requiring or needing transplants for the whole state. It also facilitates retrieval of organs from the brainstem dead donors and coordination right from identification or declaration of brainstem dead to the actual transplantation of organs. They form the organ and tissue retrieval teams. They're responsible for matching the recipient donors and organ allocation as per the policy in the state. They also help the state formulate the guidelines for organ distribution, collect the data on donation and transplant, and just like ROTO, dissemination of information to the stakeholders. They also keep a data on the follow-up of these transplant patients and their outcomes, as well as the good and the bad of the transplant is to be monitored by the SOTO. They also do the IEC and training activities and collect different data from the hospitals. The current strength is we have a director in charge, which is Dr. Sujata Patwardhan, the joint director in charge, which is myself. We have one consultant, which is Sujata Ashtekar. We have an MSW, and we have got program assistants. This is the ROTO-SOTO office, which comprises different areas for different purposes. And this is from where we actually carry out all the activities. For smooth functioning, there are different committees which have been formed. There is a core advisory committee, through which all the activities have to be run. There is a subcommittee for every organ. There is a separate committee for tissue and composite tissue. there is a separate committee for forensic. There's a research and publication committee. There's a committee to monitor donor outcomes. So this is called a donor audit committee. And you have awareness activity committee with 20 associated NGOs. And finally, we have an executive committee which helps in coordinating with the 4 ZTCCs. There are several activities which are done by the SOTO about awareness, talks, stalls, and awareness rallies with different NGOs, making up of films for training and awareness purposes. 8 films have already been commissioned for this purpose, training of the various stakeholders, allocation and coordination with NOTO for allocation, and formation of guidelines for the state, which have just been completed by the SOTO of Maharashtra. Around 250 to 300 awareness and promotional activities take place every year in the state. And this is because of the collective efforts of ROTO, SOTO, ZTCCs, and the different NGOs. We recently had this formation of a monument for deceased organ and tissue donors to commemorate what they have done by giving a gift of life. We have organized several cadaver retrieval workshops. There is a OT and a donor retrieval training center which is being established, which is now ready to be commissioned in the KEM hospital, which is developed by SOTO. The skin bank is being developed at KEM hospital by SOTO to facilitate a big filling up a completely big lacuna in the hospital and the region of a big skin bank. The success of these programs depends on the importance of coordination between the different government organizations at the regional level, state level, and interstate level. The importance of facilitated sharing and avoiding of wastage of organs cannot be overestimated. So it is extremely important that when an organ is identified, there is a potential donor, once we have raised an alarm that, okay, there is a person who is willing to donate, then right from that stage to coordinating to ensure that there are recipients who are coming in, who are ready, who are wheeled in, to the teams going for retrieval of organs, carrying out the organ retrieval safely, and the organ allocation happening, and the actual transplant surgery happening. All this requires a lot of coordination. And this can happen only if there is a very effective communication and very fair distribution. So this facilitated sharing to avoid wastage of organs is done by SOTO, ROTO, and NOTO. And together, we all create efforts to promote organ donation. So this was in 2017 when we got the second prize for the state being the best state. Then in 2018, we got the best state award for awareness activities. 2019, we got the best state. And in 2020 and 21, we got the best ROTO as well as the best SOTO award for these. This is the certificate which we got for creating awareness. This was the best SOTO award, and this is the best ROTO award. So several awards, and we now have a dedicated website. There's a separate helpline number, there's a contact number, and all the rules and regulations are already on the website. So to summarize, my dear friends, for organ donation, allocation, and awareness, ZTCC is responsible for the 4 regions in Maharashtra for deceased donor only. SOTO is responsible for the state for all these activities related to transplant. ROTO is responsible for the region, and NOTO is for the country. The cooperation between the organizations is essential for the success of this nationwide program. Thank you, and I'll be happy to take any questions.
Thank you, Dr. Shukla, for a wonderful overview of organ donation and working of SOTO, ROTO, NOTO with the transplant laws in India. So I request audience, you can put your questions in the chat box if there are any. Dr. Shukla will be there to answer for these questions. Dr. Shukla, I would like to ask you about, you mentioned about cadaver lab retrieval training. So when this is expected to start?
So actually the OT is ready. We are just waiting for the formal inauguration, and for that we are awaiting the dates from the dignitaries. So I expect in the next 4 weeks or so, we should be actually able to start it formally.
Okay. How frequently the workshop will be conducted in a year?
So it will depend on the need, but for sure we will be doing at least once in 3 months. But if there is a requirement, we can actually, the capability is to do it every month.
Okay. So we desperately need it because I think retrieval sectors are very, they are coming up. So more and more people need to be trained for the retrieval.
Absolutely. I can't agree more with you. This is so true. And there is such a shortage of these training centers. And it is impossible for people to do a hands-on training for these sensitive issues because the organs are so precious. So you don't want them to learn like they do in the residency. So you should have a formal lab where they can go and learn the procedure. And then as an apprentice, they can work with the experts and then learn.
I'm seeing a few hands raised over here. I'm going to invite them one by one to ask their question. So I'm seeing Rajnikant Wankede. Please unmute yourself and ask your question. Okay, I go to Dr. Ganesh Gore. Please ask your question. I'm asking you to unmute yourself. Till then, Dr. Shivpujay, can you please take the questions which are coming in the chat box?
There is a question from Dr. Vaishali. One sec. Is there anything we can do to make the at least eye donation compulsory like in some other countries?
I think that's a very, very good point. So there are two types of systems in the world. One is what is called as the opt-in system, and the second is the opt-out system. So we in India and most of the world follows what is called as the opt-in system, where we, those who want to donate, say that, okay, we want to donate. And for everybody else, it is presumed that they don't want to donate. This is called as the opt-in system. Whereas certain countries in the world like Spain, they actually have what is called as the opt-out system. That means it is assumed that everybody wants to donate. And if you do not want to donate, then you declare that we do not want to donate. And if you do not want to donate, then you are not eligible to receive also. So those are the two systems that exist in the world. And because of the awareness activities and such laws, Spain actually has the highest donation in the world. Their donation rate is something to the tune of 47 to 48 per million population, whereas we have not even touched 1 per million population. So Maharashtra being the leader in the country in terms of donation per million population, we are still at 1.3, whereas the countries like Spain, they have reached 47, 48. So I think there's a huge need. And of course, it's a very good proposal, but we have to understand the sensitivities of the communities, the people, and the way people behave before such a law can be implemented. So a lot of things have to be thought about. But I think this is something which we must be talking about, debating over a period of many years and create a noise about, so that eventually, at some point of time in the future, this does become a law. So I think it's a very valid point, and I think we should definitely be talking about it more.
Yes, so I invite Dr. Anirudh to please unmute yourself and ask question. Dr. Anirudh.
Yeah, good evening, Professor Akash. My question to you, because I'm a plastic surgeon in Chhattisgarh, our roto is in Mumbai, and being a plastic surgeon, I am planning to open a skin bank in my hospital very soon. For that, because I'm a PGI alumni, I have already trained my staff for skin banking details. But I talked to Professor Vinita Puri and Dr. Sunil Keswani as well. So they permitted me to for my staff training, 2 weeks training and in National Burn Center for skin banking purpose. My question is whether Roto will provide a certificate if they go for training at National Burn Center. My
Okay.
staff will be going in April.
Perfect.
Month.
Okay. So I think the first, I must congratulate you for taking this
Thank you.
initiative. And I must tell you that Chhattisgarh has recently, last month only, got the approval to have their own SOTO. And I was trying for it for the last year or so. In fact, I went to your state 3 times to ensure that the SOTO formation happens quickly. And I'm so happy that now the SOTO has formed and they have adopted the laws. And therefore, now you can actually go ahead with skin, not only skin, but actually organ donation and tissue donation. Even I think it's a good initiative which you have taken, but I think what you should do and which you are entitled to is actually have your own skin bank, because every SOTO can actually have a proposal to have their own skin bank. So you should apply to Noto through Roto and try to establish your own skin bank and have and you can have your own training lab as well. And
Yeah.
with regards to the certification process, I'm sure there will be a due certification which will be provided for the certificate for the time of the training by the appropriate people. So
Okay.
I'm not aware of who is going to actually give it, but whosoever does it, I'm sure there is a process for giving a certificate for the same.
Okay. Thank you so much, Dr. Akash.
Professor Shukla, there is one question from Dr. Rajendra Chauhan. He's asking, what is the qualification required for the eye retrieval?
Qualification required for eye retrieval. So I think this is, actually, I'm not the right person to answer this question. Is there anybody who from the cornea committee who is around?
No, we don't have here.
But I'll get back to you on
Can I
this.
just answer Akash if I can?
Yes, madam, please.
Because I was the coordinator for NGOs, and many NGOs themselves have got trained to do the
Retrieval.
enucleation and retrieval through the Bachuali hospital, and that is working quite well. And they know how to coordinate and how to keep those things, how to reach it to the eye bank, etc. So training, actually training, I have also myself gone through long ago, but retrieval is, these NGOs are really well versed these days.
Yeah, thank you. Thank
So
you, Dr.
maybe
If
we
there are
can
no
plan one
questions-
of the offline sessions, with your help, and maybe people can just register with whoever, I think because enucleation can be done even by staff. For that, you don't have to really be a medical professional. So, we can plan one offline program, wherein people will be able to enroll their staff or, support staff who will be able to learn this. So let us plan something like this. I have 2 more questions, sir. Dr. Shivpuji, we've got 2 or 3 hands raised still. So till then, please take a question. I'll ask Dr. Vidarshana to ask the next question. Do we have any question? We can take 2 more questions, I think.
Yeah, just what is the patient is enrolled at Pune? There is a question from Dr. Ajay Naksane. A patient is enrolled at Pune JTCC in Nashik and has shifted to Pune for social reason. Can she be keep the same preference in the waiting list at Pune also?
Excellent question. So this is exactly what we have incorporated in the new rules, new guidelines, which we have just gotten approved from the government and which will be implemented. So if the person can shift from one center to another center in not only in the ZTCC but in the state 3 times in a year, and the person will not be losing any of the seniority in the waiting list. So will be positioned according to the original date of registration. The same date of registration will be considered at the new center.
There is one question, I think Dr. Alka Kunthe would like to ask about What about training program in the future? Will it be online in the coming days?
I think
Yes.
so. I think we are all going to be having a hybrid in the future. There will be trainings which
Yeah.
can be done online, and
Online,
there
yes.
but I think some of the training will require hands-on, like the organ donation, and these sort of, at least for in the near future, are going to be offline and physical. But I'm sure with the way artificial intelligence is developing, we will have virtual simulators which will probably come out of your computer 10 years, 20 years down the line, and you will be doing cadaver retrieval training in your room.
Yes, but as
That's
of now,
great.
I think these platforms are proving to be a boon, because otherwise we could not have thought of, arranging such a thing, because today we have got people who have joined us even from across India. So it would not have been possible otherwise if such platforms were not there. I think with this, we are approaching the end of this first session. So do we have any more questions, or we can move on to the...
One more.
There are no questions. We
One
can
more, sir.
just
Excuse me.
yes.
Sir, can you explain the procedure for the registration for retrieval center and transplant center? And what can we do for the maximum retrieval centers in the city?
So the question is, how do we identify or register to become a organ retrieval
Correct.
center? These are called as
Center.
NTORCs, or the non-transplant organ retrieval centers. So for this, the respective hospital has to apply to the state appropriate authority, that is the Director of Health Services, to get registered. All they have to show is they have a functioning ICU, they have a competent team which can declare brainstem death, and they have a proper operation theater where the organ donation retrieval can take place. Once these three things are proven to the DHS, you can get registered as a NTORC.
So yes, we will be having our next session, as I said, in April, to identify these centers as retrieval centers and train them. So I'm sure many of the hospital owners would like to join for that. So I think Dr. Vaishali has already asked, Dr. Rajendra has already asked. Can we move on to our next session? Is there any question in the chat box?
There are no questions. Take one thing. There are no questions.
Great. So could you please just sum up the session, and we can move on to our next session, please?
Yeah. Thank you, Dr. Shukla, for a wonderful overview. And I request Dr. Patil, madam, to take over, please.
Yes. So is my screen visible?
Yeah.
Okay, just 1 second. Yeah. So on behalf of IMA Maharashtra State Organ Donation Committee, we are very, very thankful to Dr. Akash Shukla, and we present the certificate of appreciation for taking this excellent session during this organ donation awareness program of Train the Trainers, organized by IMA Maharashtra State Organ Donation Committee in association with Roto Soto on 15 February 2022. So please do accept this e-certificate of appreciation. Thank you so much, Dr. Shukla. It was indeed a wonderful session, and I'm sure people are going to be looking forward more and more to learning more about the organ donation and, trying to create more and more awareness, because I think more of the questions are going to get sorted when we have our panel discussion, which is really, really elaborative, and a lot of sequential things will be clear during the panel discussion. So my request to everybody would be to stick till the end of the session. With this, we move on to our next session. But before we move on to the next session, my announcement, please, for the day, that this program is having MMC accreditation for 1 credit point. Of course, only those who are attending the session are going to be getting that accreditation point. So yes, I being the executive member of the Maharashtra Medical Council, I cannot skip that part. All those who are here present today, please put your attendance, your MMC registration number in the chat box. Please put it only once, otherwise it goes difficult to sort it out. So please put it only once. And with this, I now invite our next speaker, who's Dr. Prashant Borade, and who's going to be speaking on process of organ and tissue donation, how organs are utilized and how to counsel. For chairing this session, we have Dr. Sheetal Mahajani. Dr. Mahajani herself is a consultant liver transplant physician, hepatologist, and gastroenterologist. She's Director Hepatology, Transparent Hepatology, Gastroenterology, and GI Endoscopy at Sayadri Hospital, Pune. So may I now please invite Dr. Sheetal Mahajani to take over the session. Dr. Mahajani, you'll be able to unmute yourself. You're the co-host. Dr. Mahajani, please unmute yourself. Please unmute yourself.
Now it's okay.
Yeah.
Okay, sorry. So without wasting much of time, I would like to introduce Dr. Prashant Borade, who's here with us to talk on his experience on organ donation. Dr. Director of Intensive Care at pioneering work in the same field of establishing multi-organ transplant ICU in a city as in a city of Mumbai, and I think it was first a dedicated multi-organ transplant ICU or critical care in the city of Mumbai. And he has throughout his career, which is a vast experience of 22 years. Over to you, Dr. Borade.
Hi, thank you, Dr. Mahajani, and thank you, IMA and team to invite me for this talk. So I'll be talking about process of organ and tissue donation and counseling the families families of the deceased donors. So I'm just going to share my screen. So I wonder whether my screen is visible.
Yes, it is.
Okay, just one second. Okay, so again, I'll just go through the basics of process of organ and tissue donation, followed by a question and answers if we have some time. So what is organ donation? So basically, organ donation is the practice of retrieving the human organs from a donor and transplanting into a recipient. Now, Dr. Akash has already, elaborated on this, but I'll just touch base on this. So basically, there is living donation and donation after brain death. And nowadays we do, the world has started doing donation after cardiac death as well. But we are not going to dwell into that today. But living donation, everyone knows that it's the near or the distant relatives of the recipient who will be donating one or part of the organ. And deceased donation, the deceased donation is basically after the brain death. So the patient becomes brain dead after the injury to the brain, and then they donate. Recipient is a patient who's suffering from irreversible organ failure and who will not survive unless and until he's been transplanted with a new organ. And the whole process is called organ retrieval and donation. Which organs can be donated? All the, the core organs can be donated: kidney, liver, heart, lungs, pancreas, intestine. A little bit about tissue donation. Tissue donation is a practice of retrieving human organs from living or human tissues, basically, who's referred to as donor, and transplanting into a recipient. What all tissues can be donated? So cornea, cartilage, bone, skin, heart valves, veins, muscles, tendons. And we must remember this, that, one single donor can save 8 lives through several organs being donated: kidneys, liver, heart, lung, pancreas, intestine, and then 100 lives through tissue donation. Improve the quality of life of almost 100 people by donating the tissues. So let's start with a case so that you have a little better understanding. So, we see every day in and out in the intensive care unit such patients who come after a road traffic crash or a stroke, and then there is no neurological response, and the rest of the organs are working, and you really don't know how to approach. I mean, quite a lot of people don't know how to approach after that. So we have got a 28-year-old gentleman who was a biker, had a road traffic accident, hit by a truck on a highway. and this 28-year-old gentleman was a biker. So he was taken to the local hospital. He was found to have a high heart rate over there. Obviously, looks like he might be losing some blood somewhere. He might be bleeding somewhere. Blood pressure was okay, but probably it might be a sympathetic drive. The blood pressure might drop later if he's bleeding. His Glasgow Coma Scale was 10 out of 15. So definitely there is something happening to the brain because of which the Glasgow Coma Scale has dropped. He was referred to the tertiary care hospital for further care. The super specialist hospital over there found that his GCS had deteriorated to 3 out of 15, which means obviously there is something going on in the brain. They did the CT brain, which showed subdural hematoma, subarachnoid hemorrhage, and cerebral contusion. Now, this guy underwent an urgent neurosurgical intervention and was brought in the ICU. 3 days later, despite all possible medical and surgical intervention, craniotomy was done, and the rest of the medical hypertonic saline and mannitol and lots of things were started, but there was no neurological response. Now you're faced to discuss, any intensive care doctor or even a primary physician under whom the patient is admitted would be faced with this situation. How do you approach the family and what do you say? Right. So let's, obviously here it looks like the patient looks like brain dead, but how do you approach the family? So you have to counsel the family, break the bad news, explain the whole process of organ and tissue donation, if at all. So it's a bit of a challenge. So this is what the process looks like. Right, so you diagnose the brain death first of all, then you refer to the zonal transplant coordination center. I think there is a practice of informing the zonal transplant coordination center or SOTO or ROTO about a potential donor or potential a patient who has become brain dead. And if it's not a practice, I think we should make it mandatory for all hospitals across all the states. And then you go ahead and discuss with the family. I will just explain to you a little bit how you counsel the family. Then you do the medical evaluation. And then if the family gives the consent for organ donation, you do the matching process and then surgical recovery of the organs, preservation, transport, and then transplantation. So this is how the process looks like. Let's see one by one the steps in the process of organ and tissue donation. So first is basically the identification of the potential donor, followed by evaluation of the donor eligibility. So you really need to know whether the donor is eligible to donate the organs or not. And then authorization for organ recovery. This step is a little elaborate. So we'll take you through all the steps here. So let's start with the first step, identification of potential donor by the hospital. Okay, so how do you identify the donor? Obviously, there has to be a brain injury in the form of traumatic brain injury because of the accident or cerebrovascular accident, right? So in that, you get strokes, intracranial hemorrhage, subarachnoid hemorrhage, patients with subdural hemorrhage, space occupying lesion. Now, space occupying lesion, one might say that, the lesion might be cancerous and you may not be suitable donor, but there are certain space occupying lesions where like glioma, you can donate the organs. They are not non-malignant and benign lesion, which if neglected can lead to brainstem death. Now all these patients because of all this basic pathological background, they will have a severe cerebral damage, and at some point they might become brain dead. Now, brain death in the past has been replaced by brainstem death nowadays, and the criteria to diagnose brainstem death involves the patient has to be comatose, so there shouldn't be any reflexes. Patient should not respond. He should be in a comatose state. Brainstem reflexes should be absent. So brainstem reflexes involves all the examination of all the cranial nerves. So those reflexes which are absent, and the patient should be apneic. So patient will be on the ventilator. So this is how you diagnose the brainstem death. These three criteria has to be fulfilled. It's not only the patient being comatose. It is a combination of all three. So very important to know, everyone. Coma has to be there, the brainstem reflexes should be absent, and apnea should be there. Evaluation of the donor eligibility. Now, obviously, if there is a deceased donor, here we are talking about brain dead donor or brainstem dead donor. Not all of them would be eligible to donate their organs, because you're having a brain stem death, but all rest of the organs are working very well. So the age criteria is there for most of the organ donation, should be less than 80 years old, but some of the organs like liver can be retrieved after 80 years as well, if the condition of the organ is good. Obviously, cancer or malignancy should be ruled out. Viral infection should be ruled out. Of course, COVID adds to that. And all routine investigations to check organ functionality should be done to evaluate the donor, and all should be fine. For example, if the kidney is to be donated, the renal function test has to be normal, including the creatinine and urine creatinine ratio, and so on. Right now, this is the most difficult part for all the doctors: authorization of organ recovery, and this involves so many steps. Right now, as I said, breaking bad news to the family members, because you know that the patient is brain dead after a road traffic crash or a stroke, catastrophic stroke, or intracerebral hemorrhage, or even if you don't know, the neurologist in your respective hospitals or your intensive care doctors will know that, okay, you're not getting any neurological response. It is likely that the patient might be brain dead. So breaking the bad news to the family, explaining the condition in detail, allowing the time for grief, then carefully approaching with the concept of organ donation, of course, after brainstem death test, then counseling for organ donation, obtaining the consent, and then informing the zonal transplant coordination center, SOTO or ROTO, if the family gives the consent, and that has to be communicated by the hospital coordinator. So this is the most important step, and I'll just take you through the step in detail about breaking bad news and how to counsel the family members before we go on to the rest of the steps of a process of organ donation. So coming back to our case, a 28-year-old biker who had been hit by a truck on a highway, and then underwent all the medical and surgical treatment procedures, and he has shown no response. And you got to do how you approach the family is break the bad news and counsel for organ donation, explaining them the steps involved in diagnosing the brainstem death. How do you do that? So these are the few steps I have come across, and this is what I practice while counseling the patient. So very important to understand this. So first of all, you need to prepare yourself and prepare the family. So a lot of planning need to be done before you just call the family and counsel them. It is not that easy because just imagine you have to break the bad news, and on top of that, when the patient's family is in grief, you are asking them for donation. So it's a tall order, but these are the steps. If you follow, things would be a little easier. So prepare yourself, understand who needs to be there from the family. So there is no concept of next of kin in India, which I have seen abroad, where the next of kin is delegated to take the decision on behalf of the patient in UK or US. Whereas in India, there is no legal concept. Next of kin is a legal concept abroad, but in India, a family member might come and say, mere se nahi pucha. Why that family, the other family member said yes for organ donation. I was not consulted. So there might be 4 brothers, and 2 might consent for organ donation. To rest of the 2, if you don't ask, they might take the objection. So very important to know which family members should be there when you start the counseling. Again, plan the meeting correctly. People, you should address the people involved in the meeting with correct names, content of the messages, know their details very well. So it should not come across that, you know, someone from the family is coming and you don't know the name of the family member. I mean, it looks very bad. So understand, so prepare yourself with all that. So you might know that suppose if our patient, 28-year-old gentleman, is by the name Amit, and the father and mother, the parents are coming for counseling, where you have to break the bad news to the parent, and you have to ask for the organ donation later on. So you should be knowing the names of their parents, so you can address them by that. So that suggests that you're giving respect and you know the information about the family beforehand. So talk to other staff members about, you know, what do they feel about the family? The family very difficult? Are they going to understand things very easily, or are they difficult? You know, so you get a little bit insight into how you approach your counseling session. So prepare yourself. In preparation, in giving bad news, what are the questions you must ask yourself? So where are you going to do the counseling? You can't do the counseling at the bedside where the patient is there. You have to take them into a room where there is no noise. You know, you're comfortably sitting there. When the patient is in grief, you offer them some tissue, some water, and so on. To whom you're going to counsel? So again, is it parents? Is it sons, daughters, children? Extended member of the family? Who are the important members of the family? Ask them if they want someone to be there with them, and when are you going to do that? So it should not be that when you're in a hurry, you go ahead and do the counseling, and you might say that I'll finish the counseling in 1 or 2 minutes. It doesn't happen that way. You have to give yourself time, so maybe 10, 20, 15 minutes, and then go ahead. So location, again, very important, has to be a private room. Everyone has to be comfortable. The layout has to be appropriate. No disturbance. You know, switch off your mobile phones or put them on silent. And same thing you tell the family members, because it's an important discussion which you're going to do. I mean, you're literally going to declare death. When the patient is brainstem death, it is actually a clinical death, and you're going to declare death. So you have to have that sensitivity. Right now, in communication skills, when you start talking to the family, these are the important points you need to remember. So listening, very important that you listen to the family members who are voicing their concerns about the patient. So whatever it might be, it is important that you give enough time for them to say their feelings, and then listen carefully. Emotional reaction. So, absorb all the emotional reaction. You have to have a little bit about your body language, need to do non-verbal communication. You can't just keep on talking. And appropriate language information. We'll just dwell into a little bit into each topic here. So active listening. So listen for meaning. You don't listen just so when you listen, you have to follow these listening techniques. So you repeat what they say. Not every sentence you repeat what they say, but important points you repeat. And if they say, "Oh, my son was interested in cricket, and he was playing the cricket for the state." So ask a little bit about what he has done about the cricket, because they are remembering the son who you declared brain dead, and they are just trying to explain and understand. This is what he used to do. He liked bike riding. He was going to go for a international competition. Just ask a little bit more. So that kind of thing, so that they feel that you're interested in their conversation. Again, facilitate the communication, what they are making about their loved ones who have had a injury to the road traffic crash. Reflect upon what they have said. Show some empathy. And again, once you finish the conversation on one topic, you summarize that topic. So this is called active reaction. Now, emotional reaction, the second communication part. Obviously, when you break the bad news and when you declare that your family member is brain dead, the reaction is going to be very strong. Our first question would be, what do you mean by brain death? So you have to explain what is mean by brain stem death. And once you explain, they understand this is what the grief reaction is going to be. First of all, these are the cycles of emotional reaction, and it will take some time for them to absorb and accept. It may not be, for some people, it might be minutes to hours, but some it might take days. So it's very important to understand this cycle. The cycle is called Kubler-Ross's grief cycle. So any bad news you get, the first reaction is denial, followed by anger. It is not the anger on you, but it is in general the anger on the situation. And then they'll start bargaining with you, telling you, no, doctor, don't remove the ventilator. You continue doing everything, don't stop medicines, don't do this, don't do brainstem death, don't do this test, don't do that test. You continue, we've got all faith, he will wake up, so all that, they will do the bargaining. And once they understand, maybe after a few hours or a few days, they will understand that, yes, I mean, the doctor was right, and there was no neurological response. So they might go into a little bit of depression. And after a certain time, they will accept. So these are the emotional reaction, the phases of the emotional reaction they undergo. And you have to understand that. Next is non-verbal communication. So when you discuss and explain, you need to give yourself a little time, silence, pause for a few seconds, let them understand. Don't, continue to have eye contact with the family members when you're breaking the bad news or having any discussion with that. Physical position should be respectful. You cannot sit on a reclining chair and, break the bad news. Your physical posture has to be appropriate, as if you are feeling the pain of the family. Use appropriate gestures. So all this important non-verbal communication has to be there. Your posture, your body language, your eye contact, your blinking way, the tone you talk, facial expressions, the time you give to explain each and every topic, and so on. So while explaining, important thing is use simple language, avoid medical jargons. Like most of the time we say, so the pupillary reflex has lost. I mean, how do they know what is pupillary reflex? So you have to explain that. So avoid medical jargons. Use native language whenever possible. If the patient is Maharashtrian, speak Marathi if you're okay with, or you can have someone from the team member who speaks the native language of the family members. Now, avoid giving information overload. Avoid giving too much of information. Deliver the information in a small bit. Tailor the information. Understand so this is where one of the steps in preparation we should go, where you prepare yourself what you're going to talk, how much you're going to talk, what information you're going to give, and monitor the pace of information. Allow the time for the family member to reflect after each sentence of yours, important sentence, and see whether they understand. So these are the important steps in communication when you start breaking the bad news. Ending the discussion, of course, offer to answer all the questions, because there will be n number of questions when the family members are going to ask you, because this is like declaring death, as I said, and they will have a lot of questions. Offer some support, like the family member or extended family member, if they want to them to be there with them during the counseling session, and so on. Arrange for a follow-up meeting. Of course, the patient's family members are not going to understand everything in one meeting. They will have lots of doubts. They will go back home. They will do their homework. They will consult few other doctors, and then they might come back to you. So arrange a follow-up meeting. Document the clinical meeting. Another important things is lots of myths they will have when you start talking about organ donation. When they accept that their family member is brain dead, and then you start asking for the organ donation or requesting them for donation, they will have lots of questions, and these are the myths. You really need to sort it out. Common myths are: my body will be disfigured, my religion doesn't allow, I will be born with the donated organ, without the donated organs in my next birth, only rich and famous get organs after bribery, and so on. So lots of myths are there, and I'm sure everyone knows how to allay their fears. Coming back to the process, these were the process during the counseling. Coming back to the process, that was the authorization of the organ recovery. Then once the family accepts that their family members the family member brain death and there is no life after that, and they understand the process of organ donation, they might give you the consent for brainstem death test. So next step after authorization of organ recovery is the brainstem death test, right? So you do the brainstem death test, inform the zonal transplant coordination center or the SOTO, and then you go ahead and try and maintain the organs, because the family has given you the consent for organ donation. So it's very important to protect those organs, because after brain death there is a high chance that the organs might start failing. So your job is to try and protect those organs. And then the ZTCC will do their process of matching the potential donors, offering them to the local area, as Dr. Akash Shukla already mentioned, these processes. And then if there is no one, no recipient available regionally, then they'll offer nationally. And then the coordination process goes on. And the last process is of surgical recovery of the organs from the donor. And then it's your job, important, to follow up with the family and thank them and reassure them that the body will be given to them in a dignified condition. And the last step is transplant after surgical recovery. The organs can be transplanted after stipulated time, should be transplanted in stipulated times. So the heart, lung, and intestine within 4 to 6 hours. The earlier the better, but within 4 to 6 hours. Liver followed by that maybe up to 12 hours, and kidney maybe 24 to 48 hours, and then tissue can be stored until it is needed. Right. So organ donation, lastly, organ donation is a noble cause. One person can save 8 lives, and many quality of life can be improved. Gain more knowledge into organ donation. That's my request to you through several different NGOs, social network, media, internet, everywhere the awareness is there. Please spread the awareness, clear the misunderstandings and the myth. And remember, it's very important that this last sentence, that remember, if millions decide to donate in the second largest populated country in the world, which is India, then many lives can be saved, including our own loved ones, if they are in need. The cycle just continues. So that's an important message I want to give. Thank you. I would take any questions if you want to.
Dr. Marjani, are you there, madam? Dr. Marjani? Okay, so I'll be inviting questions from the people who have raised hands. I start with Vidarshana Wankhede. Please unmute yourself, madam. Please unmute yourself. Dr. Vidarshana Wankhede. Okay, till then I'll move on to Dr. Rajnikant Wankhede. Please unmute yourself. Dr. Rajnikant Wankhede, please unmute yourself. Yeah, Dr. Vidarshana, you want to ask a question?
After 10 minutes, madam, I can join again. We are having 4:30 at OPD. We are having, madam. OPD start at 4:30.
Who's talking? I'm not able to make out.
Madam, Dr. Vidarshana Wankhede, madam.
Madam, we are inviting you to ask a question related to the topic which has been just taken. So if you wish to ask a question, please ask.
No, madam, I am.
Okay, so Dr. Rajnikant Wankhede, do you want to ask a question?
Both of us are living together.
Dr. Vaishali Khandait, you want to ask a question related to the topic? Please unmute yourself. Yeah, Dr. Sheetal, please take over. Okay, so there is a question over here which says that declaring brain dead and asking for organ donation. Okay, so there's a question over here. Am I audible? Am I
Yes,
audible?
You're
Yes,
audible.
you are
Doctor.
audible.
Yes. Dr. Sheetal, if you're able to take over, please take over, or I'll take question from the chat box. Okay. So is there any role of will of the patient made before death? We have Dr. Suvarna Chahankar asking this question. Dr. Borade?
Is there any role of?
Will made by the patient.
Yeah, so definitely. I mean, in India, if there is a will made by the patient, and so will made by the patient is legal. So I would accept that will, and go ahead and so this is how it is, right? When we take the organ donation, when we do the organ donation drive and take the consent of the family members, even for the living organ donation. So, if there is a will, that is a legal document. And then you take it into consideration that the patient is willing for organ donation. And if such patient becomes brain dead, then you should go ahead with organ donation. Having said that, it is very important to take the family members into consideration, and that discuss everything with the family members. That okay, this is the will made by your family member, and they are willing for organ donation. And most of the cases, I would say 99% of the cases in my experience, the family members are also willing to donate the organs of such patients who have made the will, and you should go ahead. So it is a legal mandate, but it is very important to take the family members into consideration as well.
Okay, so there's another question: declaring brain dead and asking for organ donation, both is done in one sitting only?
You can do in one sitting. So it depends. See, as I said, you get a rough idea about how the patient's family members are, when you start counseling the family members. Like I said, some family members require time to understand. You see that Kubler-Ross's grief reaction. And some family members might accept immediately, and they'll say, okay, what next, doctor? And then you go ahead and discuss about the organ donation. And some family members may just not accept. They would want to continue everything. See, this is the phase of denial. They would want to bargain with you about continuing the treatment. So in such patients, you do not go ahead and talk about the organ donation, because they have not accepted the brain death at all in first place. So continue in such patients, and when they accept the brain death, then you discuss about the organ donation in second sitting.
Okay, so how law goes in case of unclaimed person declared brain dead?
Yeah, so the patients with brain death and the body is unclaimed, the police gets into picture in a big way. And as far as my understanding goes, the police has a custody of the body. They would try everything possible to contact the family whatever information they have. And if suppose the body, there is no one claiming the body, or body is the wrong word, but I would say deceased donor, in this case, then the police can consent for the donation of the organs or donation of the body in such cases.
I think, sir, with
Archana,
your session.
can I ask a question?
Yes, please.
Yeah. Am I audible?
Yes,
Yeah.
you are. Yes,
I just wanted to know, is there any a GR from the government which can be displayed on every ICCU for regarding organ donation? Because in many places, the doctors, they don't have any correct idea. So, I hope sir got my question, what I wanted to ask.
Yeah, I understood. So look, basically, anything about brain death and organ donation, in my opinion, I don't think we should be displaying on in the ICU or any of the intensive care unit. It is simply because it is a sensitive issue. People come in intensive care unit to get treated and get better and go home. And if you're displaying information about organ donation, then the feeling is
You're not going to take care of the patient.
Yeah, yeah.
Okay, okay, right,
means,
right.
proves to be true. So it is very
Okay.
important. These are the sensitive issues. Like I said, while counseling, you have to prepare, you have to identify a appropriate location to counsel and so on. So I would not suggest that.
And one
Yes.
more question I just wanted to ask. Can I, Archana?
Yeah, please.
Yeah, I mean, can we have a logo written or some this thing stating that I am an organ donor on person license? What you said, Kina, 28-year-old died in RTA. So, agar license pe if you have written that I am an organ donor, so don't you think precious time is lost in counseling
I
patients?
think, Dr. Khandai, these would be, questions
Better to
dealing with
ask,
on the
yeah.
government side.
Right,
So
right.
I think
Yeah, I
it
got
is
it.
not a correct this thing to ask.
Okay.
So I think
okay,
this answers the question which is asked by Dr. Alka Kutte also. What about advance directive for organ donation when patient is just admitted before becoming
Okay.
serious? We cannot, because it is very, very insensitive to do so. So yes, I think this brings us to the end of this session. And we are really thankful to Dr. Prashant Borade, to have come and enlightened us on this important topic. So thank you from IMA Maharashtra State. We present to you the certificate of appreciation for taking this excellent session for medical professionals on the process of organ and tissue donation and how organs are utilized during this organ donation awareness program in association with Roto Soto on 15th of February 2022. Thank you so much, Dr. Borade. And it was indeed an enlightening session. And I think to the end of this session, if we are able to just understand 3 basic points, that there are 3 different types of donations. So one is the living donor donation, second is the diseased or the brain dead donation, and the third is the body donation, which is an entirely different aspect by itself, because what so happens is people confuse organ donation with the body donation. And that is the, I think, the most confusing part, where the precious hours are lost, wherein people are waiting for the patient to be declared dead. And after that, after a few hours, when the time for crematorium or the burial comes, that is when they start asking the questions about, that they want to donate organs. So even if we take at the end of this session one important take-home message, that when we talk about organ donation, we are talking about diseased organ donation or the brain dead, where the circulation is still going on and the important vital organs are kept alive by circulating. Patient may be on ventilator, patient is comatose, brain dead, but the circulation is still there and the vital organs are well perfused and ready to be retrieved and put into somebody else for use. So that would be wonderful take-home message, I think, from this particular session. And I think, Dr. Borade, you have really, really made it amply clear with your wonderful talk. So for our next session, as I said, the third part of this is, of course, the body donation, because we see this in senior citizens. They really, really, really wish to help the society by donating their bodies. And we hear from many of the patients saying that, we would like to donate our body for the medical cause as and when our time comes to leave this mortal world. So to enlighten us about this body donation part, we have Dr. Yuvraj Bhosle, and to chair this session, we have Dr. Niti Upasni, who is obstetrician, gynecologist, and lab surgeon practicing at Indira Surgical and Maternity Home, Dombivli. She is Joint Secretary, IMA Hospital Board of India, and Honorary Secretary, IMA Dombivli. So I invite Dr. Niti Upasni to please take forward the session. You'll be able to unmute your co-host. Okay. I think your 2 mobiles or 2 devices are there. Yeah. Okay. Yeah. So you'll be able to unmute.
Thank you, Archana. Sorry for that, because my net is not working properly. So, am I audible?
Yes, you are.
Okay. Our next topic is body donation, also called as Dehadan, and which literally means donating the whole body for the purpose of either the research or the medical education. And just now, like Dr. Ashok said, for training purposes, already the cadaver lab is being used for SCOPY retrieval center training. So, and there are few notable
Dr.
Indian
Niti, if you have 2 devices, can you please switch off the other device? Your voice is echoing.
Yes, yes.
Yeah.
Is it okay now?
Yes, yes.
Yeah. So sorry for that. And we have a few notable Indian personalities who have understood the importance of body donation, like former West Bengal Chief Minister Mr. Jyoti Basu and Bharat Ratna Nanaji Deshmukh, who had donated their body after their death for this study purpose. And we have today expert speaker to enlighten us more about body donation, who has worked in the field for more than 20 years, Dr. Yuvraj Bhosle. It is my proud privilege to introduce him. Sir has done his MBBS, MD, and DNB in Human Anatomy from Grand Medical College, Mumbai. He holds diploma in Human Resource Management from Wellington Institute. He has a postgraduate diploma in Hospital and Healthcare Management from Mumbai University, and he is a fellow of Regional Institute of GSMC and FAMR. Over to you, Dr. Yuvraj Bhosle. It is nice to have you here, and we are more than eager to listen to your lectures.
Thank you so much. Before I begin, I just wanted to make it clear that I have to finish by 4:45, right? Because the next session is at 4:45.
Yes, sir.
Yeah. Okay. So, am I audible? Any disturbance in the voice?
No, you're very clearly audible.
Okay. So, let me start with my first. Okay. My slide presentation is slightly different from others. Yeah. So the first question I would like to ask everybody, like we normally feel, or the reason people don't donate bodies is because they feel that bodies are in excess. Yeah, there was a time bodies were in excess when lot of unclaimed bodies were there, lot of TB deaths used to happen in the society, but nowadays there are no unclaimed bodies for a simple reason. Anybody who dies on the road has an Aadhaar card, has a mobile in the pocket. Previously in TB hospitals, 4 or 5 people who are coming from outside the state, they used to, and they were staying in a single room. They used to, somebody gets a TB, so they used to literally dump, I'm using the word dump their roommate at TB hospital, used to die at TB hospital because TB also didn't have good treatment, and 2, there was no communication. Now with good communication coming in, moment he is admitted in TB hospital, he calls his brother, so brother comes in, and treatment of TB also has increased very nicely. It has excelled rather, and therefore, and we are happy about it, about 2 things, that unclaimed bodies are reaching their relatives. We are happy about it, and TB is being treated very nicely and people are not dying. We are happy about it. But now we are totally 100% dependent on body donation, every medical college. I have worked for 20 years, and let me tell you, 20 years back, the scenario was that out of 100 bodies we used to receive in a year, 80 bodies we used to receive from our close by TB hospital, and unclaimed bodies from police. 20 bodies we used to receive from body donation. And in 2022, currently 80 bodies we are receiving from body donation. We need rather 80 I'm meaning 80%, and remaining 20%, rather 0 are now coming from unclaimed bodies. So bodies are not in excess, rather medical colleges will stop dissection and research, cadaveric research, like cadaveric labs we have, where people, surgeons, neurosurgeons, plastic surgeons, everybody do their hands-on workshops, cadaveric workshop. They will have to be stopped if people don't donate their bodies. So body donation has become vital now. Totally medical college depend on body donation, no other source of bodies. Previously we had 2 other sources. Is registration necessary? People have this feeling that registration is necessary. No, my answer is no. Registration is not necessary. But then still, should I register? Yes. Registration is necessary for sensitizing your fellow beings, because on the table people avoid talking on these topics, that after my death you should do this. But if I register and I tell I have registered for body donation, so if I die a natural death, my body has to be donated. Yeah, that makes clear. That inspires others also. Also, the medical college already has your all registration details. So that makes things easier. So yes, I promote people that they should, more and more people should register for body donation, but it is not necessary. Even if somebody has not registered, still the body can be donated. People ask about this act. Why only natural death? Yeah, why not? Because post-mortem is done. Accident cases, after we receive the body, all of us know, all of us are doctors over here, the body has to be embalmed. So this embalming is not possible, or rather embalming is possible only when the entire vasculature of the patient is good. If the vasculature is not intact, if there is any breakage in the vasculature, embalming doesn't take place properly. So embalming is not possible. What is the deadline? Just give me a second. What is the deadline? 6 hours. 6 hours is the deadline for bringing the body to the medical college for donation. Yeah, if it is extreme chilly winter, we can go up to 8 hours. Now, there are a lot of issues need to be discussed on this, like most medical college, whether it is there 24 hours, because Department of Anatomy normally is open only from 9 to 4. So death happens at 6 o'clock. No, 24 hours facility is there. You can just go to a medical college, talk to the CMO, deposit the body in the mortuary, and next day, of course, yeah, when the death happens outside office hours, you will have to visit twice. One, to deposit the body with a plain application on the paper to the dean of that medical college, and with a cause of death certificate, cause of death certificate. And also, I just wanted to tell you, like those who wanted to register for body donation, they also have to many times make 2 chakkars. They will have to visit the medical college 2 times, one for getting the form and second time actually filling the form. Some medical colleges on their website have the body donation forms. So it's very easy that people can just download those forms, stick their photos and 2 additional photos, one for the registration and one for the body donation iCard. And they can very easily just in one visit finish. So all the medical colleges, I really appeal to them that they should put the body donation form on their website, so people can just download and in one visit then go and fill the form. Otherwise, currently in most of the medical colleges in India, the body donor has to make 2 visits, one to get the form and secondly to submit the form and collect the iCard. Now, we are talking about the body donation which is happening after death. I was speaking till now only about the registration. Now 6 hours is the deadline. Now what happens if I am lots of kilometers away, 4 hours away from the medical college, and it's already Sunday and Monday I have to do donation? Yes, if locally some morgue is available, the body can be kept in the morgue. There are ice boxes available. If we can maintain the temperature low at around 4 degrees, it is absolutely fine. That even 6 hours I'm talking about is the 6 hours is from the moment the body is out into the normal atmosphere of 25 to 35 degrees. In that, body sustains only up to 6 hours, after which the rigor mortis sets in, and then the body is not useful for dissection or any research by any of the surgeons. So better we keep it in a morgue, we keep it in the ice box. We had many famous personalities who died and donated their bodies, whose Antadarshan was to be done for many people. So the bodies came to us after 48 hours, but they were kept inside a cooling box where temperature was maintained up to 4 degrees. Okay, so if they are ready to maintain the temperature, the body can come late also. But if no such facilities are available, then within 6 hours, the person has to reach the medical college. Okay. So this is, I have already spoken about local morgue, ice, cooling chambers, and still we advise people one more thing, that if the death happens at home and there is hours delay that is happening, instead of 6 hours, we are reaching at 6.5 hours, whatever. And because there is some antadarshan, okay, put the body at least in a AC and maintain a minimum temperature. Okay, in an AC room and maintain a minimum temperature, that will help, but not in an atmosphere where the temperature is 35 degree, 40 degree. Beyond 6 hours, the body, the rigor mortis will set in. So what are the documents that are needed? Okay, after death, I'm talking about body donation after death. One is the cause of death certificate. May not be original, because many municipal corporations nowadays, they have made it compulsory for big hospitals to register the death with the municipal corporation themselves. So cause of death is needed by the local municipal corporation or municipality for registration of the death. So one is cause of death and another is death certificate. Cause of death is issued by the medical doctors. Death certificate is issued by the local body like municipality or municipal corporation. So the cause of death, which is issued by the doctor, many times is taken to the medical college. A medical college, the body is accepted, and that cause of death original is given to the relatives. Relatives take it to the municipal corporation and get their death certificate. Nowadays, the system is that big hospitals, because people don't register the death. So what government has done is, big hospitals, you register the death with municipal corporation. Like in city like Mumbai, hospital like KEM Hospital, Nair Hospital, Sion Hospital, even Hiranandani Hospital, big hospital, they will not give you the original cause of death, a Xerox and a small strip below, because the hospital take the responsibility of registering the death, and then you have to just take the strip to the municipal corporation and they will give the death certificate. This is done so that people should register the death. Many times people don't register the death. Okay, 3 photos will be required, ID size photos. Yeah, it's not so mandatory that, but still better. Normally people have the photos, photo ID of the deceased as well as the donors, like photo ID like Aadhaar card or something should be there, because we would like to verify whether it's the same body, same person. Okay, and that is the reason these 3 photos, what I'm saying, not 3, sometimes 2, some people, some medical colleges take 2 also. That is more for to maintain the register that this was the person whose body has been accepted. Yeah, there are some legal issues. Sometimes there is a suspected homicide case, and sometimes the legal heir is not available. Yeah, if the legal heir is not available, then whoever is coming to donate the body, he should be at least a close relative, or the person should have made a will, and then even an advocate can come and donate the body of such a person who doesn't have any legal relatives. Okay, police NOC is required whenever we are coming and crossing a boundary of a district. Okay, that time this police NOC is required. Otherwise, within the city, this is not required. So this I have already explained, that post body donation, how do I register the death? Big hospitals in many cities nowadays, they do the registration of the death, and we directly go to the municipal corporation and get the death certificate. Small clinics still are not, it is not yet made compulsory for a local medical practitioner to register the death with municipal corporation. They just issue the cause of death, and that cause of death is taken by the relative to the municipal corporation, and that is where the death certificate is issued. So a small strip is nowadays given below the cause of death certificate, which the relatives have to carry with them. What are the bodies that can be rejected? One is the postmortem bodies with accident death, because postmortem bodies, their cuts are taken on the body, so the vascular system is not intact, so embalming is not possible. Yes, I want to mention about some more things about this, that we till date we were only thinking that embalming is the only way of preserving bodies, but no. Nowadays, many medical colleges have come up with -20 degree freezer. Now, what is this -20° freezer? This -20° freezer preserves the bodies as live, as near to live as possible. We take out the body and thaw it, keep it in the open atmosphere for 6 hours. Body comes to normal. You take a cut and the body starts bleeding like a normal person. Recently, I don't know how many of you have read that last few years back, we found a dead body of our soldier who was killed in 1971 war in the ice in Himalayas, and that body was fresh. The body was fresh as if the person had just passed away. So this is a new way nowadays, -20 freezers, and this is especially done to preserve the bodies for cadaveric workshops. Many departments like surgery department, neurosurgery department, the urology department, plastic surgery department, all the various surgical super specialty departments, anesthesia department, they conduct, even orthopedic department, joint replacement, they practice, ENT department, they practice various scopies. This is done nowadays on the cadavers. Okay, so, and this, for that, instead of an embalmed body, they prefer this body in a -20 freezer. Okay. Bodies with HIV, HBsAg, COVID, yes, the pandemic is now almost on a decline. Septicemia, very difficult to preserve such bodies. You know, so even if somebody has filled a body donation form, but he dies of septicemia, so thing is, we can only desire that I want to donate body. That wish may or may not be fulfilled by God, because if the person dies of septicemia, that body cannot be accepted because it doesn't last long. It doesn't last long. Okay, so it's very unfortunate. Some people desperately want to donate the body, but they end up in a ICU and get a hospital acquired infection and die of septicemia, and the body is rejected because even in spite of putting 5 liters of formalin in that body, the body literally degrades and rots. So yeah. Medical legal cases we avoid, and yeah, post-mortem bodies I have already spoken about. Antadarshan, whether it is possible, you know, people, because we have the 6 hours deadline. So that depends upon medical college to medical college. There are some medical college which say that, okay, 7 days we will not touch this body, keep it in a freezer, or we'll just embalm and keep. And within 7 days, once somebody is coming from US or Canada and is reaching late and wants to take Antadarshan, yes. Yeah, because what happens is somebody is coming from America, he will at least take 48 hours or sometimes 72 hours to reach India. Now, to tell the relatives that 72 hours you keep the body in the local morgue, it will be very expensive for them. So what we do is we accept the body, complete the procedure, and they give us a timing that after 3 days somebody is coming. So only once we said that normally wherever I have worked, we had put a condition that once in the first 7 days we can open it. After that, no Antadarshan is possible. Okay. So it depends on the policy of the medical college. Some medical college don't have that policy also. Okay. And how do I promote this? Yes, promote this by filling the forms. And I would say, why do I not promote this? Yeah. As the previous speaker was very nicely mentioning, that we don't put these forms, and Dr. Kamakshi Bhate, I think she is also there on this, and I and Dr. Kamakshi Bhate, we work together. And I was thinking of, you know, putting these posters of body donation everywhere, and madam guided me so nicely. And even the previous speaker said like that at the entrance, at the registration only, if we say donate your bodies, then the patient may get a feeling that, are you interested in my body or you're interested in curing me? So with that, we resolved with madam, with her guidance, and the hospital where we are working together, what we did is, at the local mortuary, where all the bodies after death go to the mortuary and from there the relatives collect it. That was the point where we put like 5-6 body donation posters, that there somebody can think, but not a single poster in any ward or any part of the hospital that please donate bodies. But in the local morgue, yes, we can definitely put it. Thank you so much.
Thank you, Dr. Bhosle. It was indeed an excellent presentation. And you have already answered so many questions yourself that there are hardly any questions. But still, there are few questions in the chat box which I like to take. Archana, how much time and how many questions can we take?
We can take 3-4 questions.
3-4 questions. Okay, fine. There's one question from Dr. Arun Halbe, who is our advisor of organ donation committee. Like, if person has done skin donation, can the body still be donated?
Definitely. Definitely, Dr. Arun, thank you. Yes, definitely, body can be donated. Again, medical college to medical college. Rather, I would say medical colleges should have an in-house facility. That's what we do in our hospital. That you can come to an anatomy department and we'll give you a separate room for those who have come to collect the skin, and you can collect the skin and take it back. That much facility should be there. Otherwise you get the skin removed and then get the body to us. That is also wrong. That's what I feel. So wherever I have worked, I have created a facility. In 2-3 colleges I worked, and every college I created a facility that yes, if you want to do skin donation, we'll accept the body also. Rather, we'll get the body, you come here, collect the skin and go. That is also okay. If the skin surgeons come home, that is also fine. But yes, it can be accepted.
Thank you.
No, embalming is not affected by skin.
Okay. Thank you. Another question is, how long do we need to preserve the record of deceased after body donation?
Normally, every record is preserved for 5 years. Okay. But because the bodies, once we receive, after 1 year of dissection, the body is actually discarded. So after 1 year, if somebody comes with any legal issue and all, the body will not be available. It is sent for incineration.
Okay. Actually, the next question was related to that, like what happens to the body after its use is over, or whether the relatives can claim the remnants for cremation.
Yes, yes. Where there is a will, there is a way, I must say. Dr. Shivaji Sukre from Aurangabad, so my colleague, he's right now Dean of Nandurbar Medical College. He was a person who was determined. He used to put a tag on every cadaver's ear, and he used to follow it, and till the point of incineration, and after incineration, get the asthis, call the relatives, and the asthis are there with me. And just think of the relatives' satisfaction. There should be a motivation at the medical college to do that. And yes, India has a way to go. Not all medical colleges are doing this right now.
Absolutely true, and I think it is really commendable and it should be followed by all.
Yeah.
Another question was, if there is any process is inserted in life, whether such person can donate body.
I didn't get.
Process is like there is knee replacement surgery or such thing, whether that
any pacemaker,
fracture,
any
pacemaker,
knee replacement, anything.
That doesn't affect. That doesn't affect.
Okay.
See, this is used as a discretion, madam. This body, it's better that relatives inform that the knee replacement is already done. So now I know that this body I cannot, this cadaver I cannot send for a knee replacement workshop with orthopedic surgeons, right? So I am sure that this body, yes, I can use it for the medical students. And for medical students, it is very easy because in any dissection hall, there are 10 bodies. So even if I am dissecting on a particular table where both knee has been replaced, so I want to study the anatomy, I can always go to the adjacent table and study. Okay. So currently we don't reject anybody for any reason because everybody has some utility. Even if somebody's knee, I may not be able to study because of replacement, but then there are many other body parts which can be used.
Thank you very much, sir. Archana, can we take any more questions or do we?
Yes, I think there are questions from anatomists which are relevant being asked to Dr. Bhosle. So I think let us answer these two important questions which are seen in the chat box. What if we are preserving specimens and bones? Do we need to keep a record of it? And if incineration is a legally allowed procedure. So we'll take these two questions, I think, and then we can end the session.
Yeah, incineration, yeah, that's how the body parts have to be disposed. Incineration, irrespective of the caste or religion of the person, the local municipal guidelines are there. how to dispose the body parts. So the body parts are disposed, they are carried by the agency which has got this contract of disposing, and they do the incineration. That's legal. It's not that Department of Anatomy does it. Department of Anatomy only sends by the end of the 1 year, actually the hands, legs, everything is separate. So that is packed and sent, and that is incinerated. And as regards the preserving of specimen for dissection, there is no, I have not seen any medical college doing this, and it should not be also. Or if it is done, that it was cadaver number 17 whose liver is been displayed. Because what happens is, I put the liver for display and maintain the record, and then that may hurt somebody's sentiments also, that okay, my grandfather's body had donated, and that his heart is there in that. So we normally don't, records for our sake can be kept, that's fine, you can keep it, but we normally don't keep any record like this, because we don't want anybody to access the records at any point of time, that whose heart is this and whose liver is this. Okay, once the body is there, legally donated, it's like we go to the crematorium and we burn the body or we bury the body, right? Same thing is like we go to the anatomy department and we donate it. After that, no connection with that body. So that is the principle. Yeah, so nobody should track it. So we tell the relatives that, okay, you are now donated. It's as good as cremation, as good as burial. So you think that you are buried, you are cremated. Okay, don't try to track it further. Coming, so there somebody from their medical college gets admission, the relative gets admission, and then he's trying to trace. Such things should not happen.
Okay, sir, there is one more question. Actually, the word
I
is
think Dr. Niti, we can, whoever wants to ask the question, Dr. Bhosle, can you please answer on the chat box to the question if you see it? Yeah. So
only you keep the record of identity by code number. Yeah, most of the medical colleges, they in the cadavers, you must even all those doctors here during dissection, somewhere here or somewhere on the leg, we see a tag 19, 18, 17. So yes.
Yeah, Dr. Bhosle, if you read any questions pertaining to body donation, can you please type it in the chat box and answer?
Yeah, okay.
Yeah, okay. Yeah, because we are running behind time, because panel is going to take a lot of time.
Yeah.
Thank you very much.
Yeah, so Dr. Niti, can you please present the certificate I'll just
yeah, you'll have to
put it. Yeah, just give me a second. Yes.
Thank you very much, Dr. Bhosle, for joining us, and it is our pleasure. And this is the certificate presented from IIM Maharashtra State to Dr. Yuvraj Bhosle for taking excellent session for medical professionals on body donation during organ donation awareness program trainers organized by IIM Maharashtra State Organ Donation Committee in association with Roto Soto on 15 January 2022. Thank you very much, Dr. Bhosle. Over to you, Dr. Archana.
I think, Dr. Bhosle, that was really wonderful and elaborate session. I think everybody's ideas about body donation could not have been more clearer. I think somebody just needs to listen to you to clear any and every doubt regarding body donation. And thank you so much for such an elaborate session. And yes, you rightly said you're working on this subject, which is very close to your heart for last so many years. So even in your sleep, you can elaborate on this, and you were really wonderful. Thank you so much. So for our next session now, we have Dr. Kamakshi Bhate, madam, and she's going to be speaking on topic ways to create organ donation awareness, the most important topic, because that is what we are here today to learn and to create awareness, and how IIM members, we as IIM members, we are joined by non-IIM members also. So how all doctors, we all medical professionals at our level can increase the process of organ donation awareness. And to chair this session, we have Dr. Vaishali Khandait. She is member of our IIM Maharashtra State Organ Donation Committee. She is a consultant OBGY. And she's past president of IIM Nagpur. So over to you, Dr. Khandait. Dr. Khandait? Dr. Vaishali? Okay. Your co-host, madam, please unmute yourself.
Yeah. Am I audible now?
Yes, you are audible.
Yes. So At the outset, I would like to thank IIM Maharashtra State for this wonderful awareness program, because this was the need of an hour. And so many questions were, I mean, we knew from the panel, from the speakers, so many unanswered questions. Thank you so much. The topic, for the next session is ways to create awareness on organ donation, how IIMA members can help. And for this, I would like to invite Dr. Kamakshi Bhate. She is Professor Emeritus Community Medicine, GSMC, KEIM Hospital, Mumbai, Advisory Committee Member, Roto and Soto, Coordinator, NGO members in charge of Patients Education Center, KEIM Hospital, Mumbai. So this, I request ma'am to please
Thank you
enlighten
very
us.
much. I'll straight away go to the subject because we have a lot of things to be discussed, since this is for awareness and we are looking forward and do awareness with the general public. So I'm starting my presentation, please. One moment. Yeah. Share screen. Is it visible?
Yes, madam.
Yeah, one moment.
If you can just increase the screen size.
Yeah, I'll do that.
Yes, it is visible.
One moment. Awareness about organ donation, creating IEC material. IEC is information, education, and communication material. It's very important to create the material which is correct, which is important, and which is which removes all the fears and worries from the people's mind. So let's see how we do it. IEC information, education, communication. Any project or any program can never succeed. Like, for example, now Roto Soto's project of organ donation can never succeed unless people participate in it and unless people are informed about it and made aware about it. Organ donation, it's a new concept. So new kind of IEC material has to be developed. Give complete information. Do not hesitate to give complete information. So information is what it means, which organs and tissues can be donated, how is the process, who gets the benefit, is it legal, can you back out after the pledge form is filled. All these queries and questions which might be there in the minds of people, which we will have to address. And we have to do it very, very carefully. In the sense, we have to be very sensitive about it. What is IEC material? It could be electronic, it could be non-electronic material for educating the stakeholders like patients, relatives, all general public, etc. It could be simple pamphlet or a booklet or a lecture of any kind. It could be posters and standees, which we are very, we are using it at present with Roto Soto quite extensively, the posters and standees. Flip charts really help when it's small group discussion about organ donation is there. Scroll boards have always helped, to inform whatever is happening and continuously changing that we have done. Then PPT and slides, of course, they help, and one can very freely use the slides. I can even pass on Archana with the sensitization slides for your use. And slogans, placards, banners about organ donation, Angdan, Mahadan, etc., can be used. We had even year when we had these Diwali cards made for our institute, and New Year cards and etc. about organ donation, which told about organ donation, which advertised about organ donation. Badges, green ribbons, logos, caps. People really want to use all that if they are aware about organ donation. And that really helps. Somebody says, what is this green ribbon for? So I can even answer what this green ribbon is for and what is organ donation. Once we had an awareness session in a in a nearby degree college. And once we went next time, the principal was putting his donor card, very huge color Xerox of the donor card was under his, on his table under the glass. And what we asked, why have you kept it? Why have you enlarged so much? He said that you people will come and give lectures, but I can't do it. But people like you, people like my, the parents of the students, when they come here, they'll ask, what is this? Then I can have little small words with them that this is the donor card and what it means. Ideally, there should be sufficient exposure to IEC materials to reinforce the information. The reinforce will really help people to accept it easily. So basic facts about organ donation have to be repeatedly told. And facts about the law about the organ donation, of course, we are law-abiding people in India. So we have to be knowing it and we should be informing the people. Good IEC materials are important components of the comprehensive education campaign, as it has to be well informed as well as it has to have a emotional appeal. It's very important to have a. Our pamphlets are very simple, but it gives a very nice information in the sense it's in question answer form. So whatever is there in their mind, we are answering. And it is very simple language which is used, and most of it we have taken it from what students have asked us in degree colleges. Now use always authentic statistics. Don't say मैंने ऐसे सुना था, मैंने ऐसे देखा था. We always use NOTO statistics. What is the requirement and availability of the organs? Now kidney requirement is huge all over the country, and only 6,000 kidneys are available. And how many of them are accepted for donation, or it has got donated? It's not known. Liver, 30,000 are required, whereas 1,500 we are donating. Hearts, 50,000 are required, only 15 are donated. The government of India gives a very high priority for improving awareness on donation of cadaver organs, to bridge the gap between the demand, because the demand is very huge, and to supply, so that all the people who require them, they get them in time. And organs are for saving the lives, which is very important. Regular IEC is like that. That is, this is a person who has liver damage and his liver failure is there, and his failed liver is removed, and the cadaveric organ is implanted there, and the person looks so different. I like this slide very much. This is not made by us, but we always think that good IEC material, whoever has made, should be used. So that don't think that we have to only make it. Use whatever is very much available. Now, these we have prepared for common public. That some posters which can be put in huge, maybe make huge posters and put them in lifts, so that people, when they enter the lift, they are watching it, they can see it. So some small little information is there which is in the lift, but otherwise on the boards and all that, we can have this more information, which has information as well as emotional appeal, saying that these are the kids, and some of the kids who cannot see the world from the birth itself. The corneal donation can really make these children see this wonderful world. And for that, don't worry or burn your eyes, and inform your relatives. Somebody earlier also asked whom to ask. It is important to inform our relatives, even if we don't make a will. If we inform our relatives, that will mean they will be really well prepared. Get more and more people, as you people have done, more and more people to help the campaign. It is important to have more people to help the campaign, otherwise it will not go anywhere. In all cases, it is important to identify trainers and peer leaders who speak local languages and ideally are from the local population. Believe me, that we have around 150 NGOs working with us. I am the NGO coordinator, and earlier I would think that how will they carry this information, because it is scientific, that's what we think. Whereas our small group discussions, trainings, and again and again trainings have made them so good that they have these yatras all over the country, and that is what actually gave us the leader, made us the leader in the country, because they are very, very committed. It's important to find committed people. Don't worry about whether They will understand because they want to understand, and they will give very scientific information. These individuals also will be most effective. Adapting the IC material in the local listing, we have given few things to them. They have created their own material. So their material is equally important and equally effective. Special IC for special days should be there so that the monotony is removed. August 13 is observed as a World Organ Donation Day. So for something for August 13. Or there was Valentine's Day yesterday. Some things for Valentine's Day. It's very important so that you really break the monotony, make people watch this. Valentine's Day, I just put more posters because we had just yesterday. One donor can save up to 8 lives. So I showed it by showing that it's a packet with 8 chocolates inside. Sign up on Organize and Tissue Donor via this site. So I'll be even showing you what sites are available. This is a gift of love, etc. Just made it again and again so that on the occasion of Organ Donation Day, pledge to donate and save lives. I can pledge, maybe it's my birthday, it is somebody's birthday, my daughter's birthday, something, some occasion is found, and then I pledge. And I inform others that you also pledge. So some people ask, whether my religion allows it or not. Will my religion allow this organ donation? The represent love, and organ donation is a gift of love. Who represents love? All the religions. Religions represent love, and organ donation is a gift of love. Be a symbol of hope for those who are waiting by pledging the organs. So register today to be an organ donor for eye and tissue donor, whatever may be, even the body donation. We use the special occasions in our institute. We have Ganpati. We have actually eco-friendly Ganpati in our this thing, which is made by our students, and then we have such talks for maybe students, for relatives, for other staff members, for nursing staff, everybody, and we have this through our organizations like MARD, etc., etc. So one MARD member for 1 year, he stood with this this thing for 1 hour every day, so that I am an organ donor, and he was showing that on this. And it's a novel idea. Creating novel ideas is important part of IEC. We made some posters for Smashan. We said that भगवान ने अपने अवयव प्रत्यारोपण का काम डॉक्टर्स को सौंपा है, तो मृत्यु के पश्चात अवयवदान करने वाला और जीते जी अवयवदान की शपथ लेने वाला ही भगवान को पा सकता है. इट्स अ इमोशनल अपील. तो क्या आपने मृत्यु के पश्चात अवयवदान किया है? The person has already died, but the relatives are there who are emotionally charged when they say ask where is this thing. So we had even sometimes kept the forms inside the Smashan. Give your heart and lung and stuff for Valentine's Day. It's a very simple information, but sounds very this thing that it's for Valentine's Day. Now this is my student actually, Komal. She had her in her marriage. She said, "Don't give me any gifts. No wedding gifts are required. I want you people to pledge your organs on my wedding day." So such novel ideas are very good for IEC. Then okay, World Organ Donation Day also maybe, and it's a gift of love, etc. So this whole this thing of one donor can save up to 8 lives is said in so many ways, so that it fits into the mind. So that we have a scroll board going on, very nice scroll board, and newer posters are put. These days actually Noto is sending those messages. Now most of you must be using Twitter. If you agree, we can even pass on the Twitter information given by Noto to be retweeted by you people, so that you are part of the awareness campaign. It's a very simple way of doing it. So save 8 lives, pledge today, give organs, etc., etc. And an IEC campaign can't be effective alone. Other components of your strategy should be included. That is face-to-face talking. You can't simply say that, I have a poster and people will understand. No. face-to-face education is very, very important. Answer the questions and helping people to know how to access pledge form is very essential. I will be also showing you how to access. But these are some of the posters. आपण 8 जणांचे जीव वाचवू शकता, मृत्यू पश्चात अवयवदान करा. Or simple things like that in Hindi, Marathi and English, we have them. Be an organ donor. All it costs is little love, which is a very simple thing. And these people from Andhra Pradesh, they have something called click here, and the donor pledge form appears there. So this is a very nice and novel way, and everybody should develop novel ways. You know, these days our children are very good in making these things on computer, on mobile, etc., etc. And so many of our NGOs, 150 NGOs and their children joined the whole this thing. So they have their own ways of representing it. Then slogans are there, which are very, very important. Like slogans like, you can't take them with you, so better donate them here. Slogans like donate an organ and save life. Tap into interests of the local population, whatever the interest of the local population is. Keep the local situation in mind. Don't simply use all English posters. Use all this thing posters. Now this we had used with this thing because we had so many awareness camps with the nearby churches. So all of us can be donors by pledging on organ donation forms, etc. Have you pledged your organ to be donated after death? Do it today. Here in the cemetery, we have the pledge forms. This is also our cemetery poster. We had even in our dean's chamber a small corner where it was written, have you pledged your organs? So if you're not, then before entering dean's chamber, why don't you pledge it? So we had those pledge forms, and somebody in the evening, which are filled pledge forms, are collected. Now such information is given in local newspapers. That really helps. I have written it extensively during when I was in the beginning. Then now I have realized that people know many things about this organ donation. So why not, actually we had a small survey. I'm so sorry. We had a small survey 6 years ago. And as in the beginning, it was said that the small survey was how much the nursing staff knows, how much nursing students know, how much medical students know, how many PG students know, how many staff members know about it. And we realized that everybody knew equally bad. So we have to create awareness again and again. So people can write in the newspapers also. National Organ and Tissue Transplant Organization, let us pledge to donate organs for saving lives. And there are some numbers given. I am a doctor or donor. Sorry, I am a donor. Where there is another poster which says I am a doctor donor. So such things are there. But it's very important. Did you know that simple chat with your loved ones is very important? It can save lives. One of our another colleague, Dr. Kailash, he has Ganpati in his house, and he would तो असा ऑर्गन्सचे तुकडे हे म्हणजे ह्याचे लावायचा कागदावर ड्रॉ करून इथे लिव्हर लावलं, इथे किडनी लावली, इथे लंग्स लावले असं वगैरे. तर डेकोरेशन, गणपतीचं डेकोरेशन. People would ask, why have you kept it there? For you to ask me. And he would go on explaining what is organ donation. So people who came for darshan knew everything about organ. So it's important that I'm taking lectures, and does my family really know about it? So it is important that my awareness should reach to my family. Whatever I have learned today should reach to my family. So it's important that effective materials are clear, communicate specific messages, and are easily remembered, so that person can easily go and tell the relatives. It's important. So our IC material has to be very simple and effective and emotional, which will make people do it. So such a emotional this thing I had said once, and scientific thing, like, you know, there are so many 10 lakh people who are blind in our country, and 3 lakh every year become blind with cornea haziness, and then 60% of them are less than 12 years, etc., etc. So you can, so you know, in our country, very sad state that we require 3 million every year the corneas, and we import corneas because we are donating only 1,50,000 corneas. Where are we importing it from? A small country, Sri Lanka.
Madam, sorry to interrupt, but we are getting late. We are running out of time. Sorry
Okay.
to interrupt.
So, okay, then you can use the already prepared material, or you can create your own material. This is for children. In the schools, we had created this, and it was very, very popular. This is in English and Marathi. This is to prevent accidents, and we have this around the prevent accidents. We have even used the pledging of the organs. Then giveaway, people really like it. T-shirts, bands, caps, etc., which really helps. So such material is created. It's a stamp created by some country on the postal stamp, which is also very helpful. We can tell people to draw these things, Rangoli competitions, so that you will have more and more IC material. Such people who, when they come up and say that I'm an organ donor, you feel very nice. Therefore, eye donation 1919 is a number which can be remembered easily. There are 29 eye banks in Mumbai, but I won't remember every eye bank's phone number if the death has happened at home. But 1919 I always will remember. So that is how one can even say that I want to donate my eyes. The relatives can do it, and there is a detailed way of knowing what to do when the death is there at home. How can I register myself as an organ donor? So simply remember www.rotosoto.km.in. So you can just get into that, or www.noto.gov.in. So this is what you can simply get into it, and they will give the form. You can just online register and you will get your donor card. One eye donation can make two blind people see. Make simple, colorful posters. It will be, I'll just play this. It's very important. So just, I hope there is. Can you hear anything? Anyway, that we could not see because it was simply whatever you have understood or not, that is the checking. I don't know why it's not playing.
Madam, you'll have to share sound as well if you want to play.
Is it that okay? One moment.
It is there in the share screen option.
Okay.
At the bottom of it, you will see share sound also. There are two check boxes.
Yeah.
So you'll have to check share sound also. Only then you'll be able to share sound.
Optimize share sound. Yeah.
Yeah.
So can I go back to that? Okay.
Yes, you can just go back and play it again.
Yeah. No, this is not. How to go back? Yeah.
Opening Frame. This is an animated video about produced by the U.S. Department of Health and Human Services, Health Resources and Services Administration. What do you know about organ donation? Let's check with a quiz master. Number 1. How many lives can you save as an organ donor? One donor can save up to 8 lives.
Anyway, I can't hear anything. I think you people also can't hear anything.
Madam, we can hear. It is audible.
Sorry.
Intestines and kidneys. And one donor can improve many more lives by donating corneas, tissues, heart valves, blood vessels, skin, bones. Number 2. True or false? Most major religions in the U.S. support organ donation. True. They consider it an act of love and generosity. Number 3. How many people in the U.S. are waiting for an organ transplant? More than 120,000 people are waiting for a life-saving transplant. Number 4. If you are an organ donor, how much will it cost your family? Nothing. There's no cost to donors or their families for organ or tissue donation. Number 5. Spot the difference. Life-saving emergency care for registered donors. Life-saving emergency care for non-registered donors. It's a trick question. People receive the same life-saving care regardless of their donor status. Number 6. True or false? The rich and famous wait their turn for organs just like everyone else. True. Rich and famous people don't get any special treatment on the waiting list. Number 7. Is any age too old to be an organ donor? You are never too old. What matters is the health of your organs. Number 8. Yes or no? Can you donate if you have a medical condition? The answer is sometimes yes, sometimes no. The doctors will determine if you can be a donor when the time comes. So sign up anyway. Number 9. Yes or no? Once you sign up as a donor, can they come get your organs at any time? No way. Registering means you're willing to donate your organs after you die. Number 10. Yes or no? Can people of different ethnic backgrounds donate to each other? Yes. People of different ethnic backgrounds frequently match and donate to each other. Number 11. How many
Madam, we are running behind schedule.
Yeah, okay.
Can we please wrap up the session?
Yeah. Any questions? I'm ready. There is a small story, but I'll
Madam, we can take question answers at the end of this session. We will need to start with the panel discussion.
Sure.
Ashtekar Madam, thank you so much, Madam. Vaishali Madam, can you please present Madam with the certificate?
Yeah, sure. Yeah, can you please display?
Yes,
it?
I'm displaying. Just give me a minute. Madam, if you can, yeah. If you can just stop your screen share. Yeah, okay, you've done it. Okay.
Yeah, thank you, Kamakshi Madam, for that wonderful talk and wonderful slides you do have. And on behalf of IMA Maharashtra State, this is a certificate of appreciation for taking excellent session for medical professionals on ways to create organ donation awareness during organ donation awareness program.
Madam, are you there online?
Kamakshi ma'am?
Yes, I'm there.
Yeah.
I'm there.
Yeah, acha. I'll continue. During organ donation awareness program, Train the Trainers organized by IMA Maharashtra State Organ Donation Committee in association with Roto Soto on 15th Feb 2022. Thank you so much, ma'am, for your wonderful talk. Thank you.
Thank you so much, Madam. And I'm sure each one of us can use the material which you have just displayed. We would request you to even share it with us if you can. And we will spread it across to our IMA members also, so they can do the needful in their own areas and to their own patients. So thank you so much, Madam. Yes, we need to develop our own novel ways also. We can develop, to spread awareness regarding organ donation. And Madam, you made it really amply understandable to everybody. And so with this, we come to the end of the scientific sessions as of now, and we move on towards the panel discussion. Basically, now we will try and cover the entire thing, whatever we have learned today in 4 different scientific sessions. We'll try to take it in question answer format in a simple flowing manner, as in how we would want to understand it in a very, very, very simplified way, or even we would, try to clear our myths and understand the facts regarding organ donation. And so once we are aware, we will be able to do the needful of awareness for our patients and of course the relatives who approach us for seeking advice. So for the panel today, we have Dr. Akash Shukla, who's the Joint Director of Roto Soto. He'll be joining us in 2 minutes' time. We have Dr. Prashant Borade, who has already, presented a wonderful session. Dr. Yuvraj Bhosle, who has spoken elaborately on body donation. Dr. Kamakshi Bhatte, Madam, who has spoken about the process of organ donation awareness. And Mrs. Sujata Ashtekar, who is consultant at Roto Soto and ZTCC coordinator. So welcome everybody, and maybe Ashtekar Madam, is Dr. Shukla joining? Ashtekar, madam? Ashtekar, madam? Okay. May I just mute myself for a minute? I'll try and call up the consultants. Just give me.
Okay, yeah. Okay. I'll just try. I hope he joins. Yeah.
Okay. So, madam, till the time he is being contacted, may we start with the session? Maybe his questions may be covered by Dr. Prashant Borade and you. Ashtekar, madam?
So, yes, we can start with the session on time, but he's not able to.
So, madam, may I start my first question with you? How many patients need organ transplant in India on an average?
5 lakh patients need transplant, that's what they say. But if we go to Maharashtra figure, there are more than 5,000 patients who are on the wait list for kidney and around 1,000 patients for liver. Now the number of liver may look little less as compared to the patients, because we all know they have the dialysis as an option, whereas liver patients do not have option. So many of them die waiting for an organ. So this number remains the same, but at the same time, names keep on changing. So on average, it remains 1,000. Same with the heart, around 100 patients any given time are listed for heart. And for pancreas, we have around 35 patients. This is the number of the listed patients. So those who are fortunate enough to approach the hospital, they go through the whole procedure of getting listed, like they are medically tested, prepared, and then registered. So, but the need is definitely more. So they say 20,000 patient anytime for liver in the country. So
okay.
It's the need. And if you the number of donors which we have coming, the maximum we have done in the 2019, which when we got the best state award, was 160 brain dead donors, excluding the tissue donors, skin and cornea. So even we say all the 160 were able to donate the kidneys, then it's only 320 as compared to 5,000. So it's a huge gap.
Okay. Yes, absolutely. And that is the precise reason we need to increase the organ donation awareness amongst people. Dr. Borade, my next question comes to you. Can you now, since the idea is more clearer to people, can you please enumerate now once again in very short about the living donation, donation from brain dead or deceased donor, and body donation, and why can organs of a brain dead patient be used for transplantation and not those of a patient who has died of cardiac arrest? So all the 3 types of donations, and why one can be used and one cannot be used. Please unmute yourself, Dr. Borade.
Yeah, sorry. So living donation, as everyone know, part of the organ, like a part of a kidney, part of a liver, or one kidney, a single lung can be donated. And of course, so many tissues. In deceased donation, so deceased donation can be categorized, or it is categorized now into 2 types. One is donation after brain death and donation after cardiac death, right? So donation after brain death is, as I explained everything in my talk, brain is died because of some etiology, either the road traffic accident with a brain injury or the stroke or intracranial bleed or something like that. And nowadays, you can do donation after cardiac death. But donation after cardiac death has to be, it is a new concept in India. People are going abroad to understand a little more about that, where after cardiac death, you put the patient on heart-lung machine and then let the organs, kind of revive for maybe for 4 to 6 hours, and then you can retrieve the organ. And body donation has to be after cardiac death. Both in disease donation after cardiac death and after body donation, you have to have some cooling period. That cooling period has to be between 10 minutes to half an hour, depends on country to country. So this is how the procedure goes for each of the donations. So 3 broad categories: living, disease donation, and body donation.
Great, superb. So now it has made, I think, amply clear to everybody that it can be done at every step. Only thing, probably the organs and the tissues which are retrieved are different. So now I come to my next question. What do we understand by organs and tissues? So what is the difference between these words, and what organs or tissues can be donated by each type of donor?
Okay. So organs are all the vital organs like heart, lung, liver, kidney, intestines, pancreas. These are the organs, right? Which are really, without the organs, you cannot survive. And if you have one of these organs failing, say for chronic kidney disease or chronic liver disease or heart failure, or lung damage because of interstitial lung disease or COPD, you may not survive. At some point in time, without that organ, you will just not survive. And that's the reason why you need organ donation, right? Now, in case of kidneys, you can survive for some time, on dialysis, but your lifespan is less. So in living donation, you can do the transplantation at any given point in time, at any stage of the disease, if the specialist is advised. In a disease donation, you have to have a complete failure of the organs, and then you can donate. Now, when you have a disease donation, when after the brain death, heart, lung, and intestines can be donated within 4 to 6 hours. So you shouldn't really waste time. So as and how the organs are retrieved, within 4 hours, it should be transplanted. Kidneys can take up to 24 hours, and liver can take up to 12 hours. Now, again, there is a lot of advancement. There are normothermic machines which keep the organs going for longer duration, which are available abroad, but not in India. But these are the modern methods you can adopt if you want to prolong the maintenance of the organ. And even while, very important point to remember, for the intensive care physicians or even the physicians, whilst your brain dead patient is there in the hospital and or in the ICU, and the families have given the consent for organ donation, it is very important for you to maintain those organs. So your blood pressure has to be fine, your heart rate has to be fine, your urine output, intake output balance has to be good. All that, it is in your hands to maintain the organs for longer time. But after retrieval, as I mentioned, the times, that time should be respected, and transplanted organ should be transplanted immediately. Coming to the last part of the question, tissues. Tissues can be recovered and stored for longer duration. So heart valves, veins, your muscles, your tendons, the bones, it can be stored for a long time. And whenever there is a need, you can donate. For example, if there are victims of burns, right, and you need the skin donation, the skin can be taken from the bank as it is stored, and then transplanted. Of course, the matching has to be there, and so on. And same with the bones and the ligaments and rest of the tissues.
Great. So this brings to my next question as to, I think everybody is aware now of how the organs, how they are retrieved and during what time they have to be put into, transplanted into the other person. And you said that the tissues can be saved or preserved for a longer period of time. So we know that there are skin banks, we know that there are eye banks, but then how are the other tissues preserved for a longer period of time? Where are these banks?
So these banks are there in certain, I think they are there in some teaching hospitals, in some of the key private tertiary care private hospitals as well. And it is the pathology department which are supposed to maintain the organs and store them in different type of chemicals and certain type of temperatures and so on. So unfortunately there are not many institutes who do that. Very few in Mumbai and in several major cities. But yes, I mean, if you are a transplant hospital in any part of the country, you can request for the organs from these institutes, of course through ZTCC and SOTO and ROTO.
Okay, Dr. Bhosle, since you deal with the medical colleges, would you like to add anything to this question as to where are these tissues stored? Is there anything with the medical colleges?
No, because I'm not into tissue donation.
Okay. Okay. So my next question to you. Yes, ma'am. Please.
Actually, all medical colleges do not have the bank. So we are attached to any of these eye banks and skin banks and all that. And they come, they collect and they take back. And unless it is a bank that can't be stored, there is no place where it can be stored in a medical college like that.
Okay, so madam, are there any banks for the for storing the bones or the ligaments or other tissues?
Yes, no, we don't have. In India, we have only bone bank, which is there in Tata Hospital.
Okay.
But we do not have ligaments and all that because each bank costs a lot.
Okay.
So we have 29 eye banks and we have 3 skin banks in Mumbai.
Okay, great. So this brings me to the next question, which is for Dr. Bhosle. Can a dead body be left for medical education or research after the organs have been retrieved for donation?
Definitely, because thing is that the organs are retrieved surgically, and whenever they are retrieved surgically, whatever blood vessels are cut, they are tied. So that doesn't affect embalming in any ways. So if surgically nicely the organs are removed, definitely the body can be taken up for body donation.
Okay. In case of a death at home, can relatives take a decision for body donation? Like the patient's will is not known and the relatives feel that they want to donate the body, for these purposes. So can that be done and how are they supposed to proceed?
Madam, as per the law, the dead body becomes a property of the legal heirs. Like for example, suppose somebody's father dies, so the bungalow now goes to the son and daughters. Similarly, the body also becomes a kind of a property. So it's that everybody who is a legal heir has to agree firstly for the donation. Okay. So if one of them says, no, I want to do the Anta Sanskar, then we cannot accept such a body. There are occasions where we have accepted body, and one brother comes and says, I want to do Anta Sanskar, and has taken body from the anatomy department. So such things happen. So first thing, everybody has to agree. Now, even if that person's will was not there, still, if all the legal heirs say that we want to donate, it's like a property. After my father's death, we 3 siblings, we got his property and we decided to donate it. Something same is for the body. Of course, it is little unfair that that person didn't want, but relatives don't. But that many times happens in case of poor patients in a government hospital, that they don't have money for Anta Samskar. So they say that I would just want to donate. So such unfortunate things happen. So against the will also, yes. And sometimes it's the will of the donor that I want to donate, but after the death, the people, the legal heirs, they say, no, we don't want to donate. We want to do the Anta Samskar.
So basically after death, or rather even in the case of brain dead donors, it is the relatives who ultimately take the decision, and every relative, like all the close heirs or the next of kin, have to be in they have to be in unison and they have to be on the same page to be able to do this. Yes, madam.
As per law, the spouse has the most say.
Yeah. Yes.
Wife or husband. Then children, it could be daughter or son. Then it could be brother. And as Yuvraj said that if somebody agrees and somebody does not agree, then if that spouse has said yes, then it is yes.
Yeah.
But
Okay.
if
No,
two
no,
children
no,
are there and one
no,
says no
madam.
and one says yes, then no.
Now, Ashtekar madam would like to say something.
Yes, it is very clearly given in the law that one of the close relative who will sign the consent form in form number 8, knowing that no other close relative has objection. So the objection taker is a close relative, which is very clearly defined in the law as spouse, children, brother and sisters, grandparents and grandchildren. So the objection taker is one of them. So no hospital goes away with the donation, even if the spouse says yes and brother say no.
Okay. Okay.
So it is basically, but suppose some uncle is saying no and the close relatives have agreed, then then we may go ahead. But
Okay. So as defined by law, whichever are the close relatives, they have the right to object or to agree.
yes, and all
Okay.
should say yes.
Okay, okay, fine. So Dr. Bhosle, you have already enumerated in detail, but now I would just request you to very, very briefly enumerate for us that which bodies are rejected for body donation. Very briefly.
Yes, madam. HIV, Australia antigen, nowadays the COVID positive bodies, septicemia bodies are rejected, postmortem bodies because they are cut and the vessels are not tied again. So therefore, and deaths due to accidents. But yes, after that accident, accidental deaths normally go for postmortem most of the time. So therefore, we don't.
So any other medical legal cases are rejected, like say poisoning or any other cases? I mean, if the relatives agree to that.
Medical legal case is rejected. Normally, we accept bodies by who have died by natural death.
Okay, okay. So by natural death. Okay. So just another question. Body donation is now covered under which act? Dr. Shukla enumerated in detail about the body, this donation and transplant. But what about the body donation?
This Bombay Anatomy Act, which is long, very, very old. Don't think that it is restricted to Bombay. Bombay was a province that time. So Bombay Anatomy Act, the entire information about body donation is available in Bombay donation or body donation.
Okay, okay. So Ashtekar madam, in case of a living donation, my question is that, is it possible to receive organs from a friend or anybody other than the relative, like what we spoke about as the close relatives? And what are the ethical concerns with living unrelated donors?
Yes, it is possible to get the organs from other than near relatives, which is under the clause of love and affection. So for example, who can have a love and affection to whom you know for many years? So basic principle of the law is to see that there is no commercial transaction, which is the purpose of the Human Organ Transplantation Act here. So if someone is like donating, suppose say no close relative is available, like spouses have some blood group is not matching, and then suppose the in-laws want to give, or uncle wants to give, so they are considered unrelated. So they can be done under the special cause with the prior permission of the authorization committee, which has been established under the act. So if that authorization committee gives the permission, then the hospital can go ahead.
Okay, so can you just briefly tell us once again that which are the related close donors which are defined by the law?
Close relatives as defined by the law are spouse, that is husband and wife to each other, brother, sister, son, daughter, mother, father, and grandchildren and
grandparents. Okay,
which
great.
was added in 2011 amendments, the grandparents.
Okay, so now this question next is open to anyone who can answer it. I will be asking it to Ashtekar madam. Does Government of India financially support this organ donation in any way? Are there any financial supports coming from the government, any schemes or anything for anybody below the poverty line or anybody?
Yes, there are. Actually, under Noto Roto Soto has been established under National Organ Transplant Program started by the Ministry of Health and Family Welfare. So under this program, the network of Noto, which is apex body at Delhi, 5 Rotos has been established, and the Soto in every state. now under this program, there has been the provision of helping for the immunosuppression below poverty line patient for 10,000 per month.
Okay.
Now we actually, even today only, we have got the funds for the same, so which will be giving to the patient. So yes, there are provisions for helping the poor patients for immunosuppression basically.
So not for the transplant, but for the post-transplant care?
Not exactly for the transplants, but for post-transplant care, because for transplant they can get from Pradhan Mantri Yojana.
Okay.
Other like from the Chief Minister's Fund.
Okay.
One-time operation, but for transplant, just after the surgery, actually the whole thing starts, because compliance and they have to be on the immunosuppression long. So for that, something was needed, and OTP has this provision.
Okay. So my next question is to Dr. Borade, is that what are the charges incurred by the families of organ donation, those who are donating the organ? My question is for those who are donating the organ.
I don't think there are any charges incurred by the donor family. In fact, suppose if the family is there and the treatment is being carried out in any hospital where they have to pay for the services, what I'm aware of is once the family decides to donate, we do the 2 apnea test. Apnea test is nothing but the brainstem death test, which I spoke in my talk. And after first apnea test has to be done as a diagnosis of brainstem death, and the second apnea test is to be done 6 hours after the first apnea test. It is just a process, and it is in the good medical practice process, which 2 apnea tests has to be done, and internationally it is the same rule. Now, after the second apnea test, the families of the donor don't have to pay anything to the hospital, and there are no costs involved for them. And in certain hospitals, even after the first apnea test, depends on the management of the hospital, they would, let go the cost involved between the 2 apnea tests as well. So,
yes. So this is a very important information, that once the family decides to donate the organs for a patient who is brain dead, the hospitals generally waive off the charges post the apnea tests. Next question is in relation to this. Just an idea regarding the transplantation cost. If you could just, in brief, tell us what are the roughly transplantation costs involved.
See, I wouldn't be aware of the transplantation cost, but different hospitals will have different transplantation cost. The recipients are not charged for the organs, right? It is the process or the procedure carried by the surgeons, and whatever the consumable charges are, which is incurred by the hospital, are passed on to the family members, as would be for any illness if they are admitted in a certain ICU or in a hospital. So there is no special charges for the organs which they receive from the donor family. The charges for the kidney donation can range from anywhere between 5 lakhs to 15 lakhs. For liver transplant, it would be somewhere around same, a little more than that, maybe 10 to 15, and so on. I'm not completely aware of these charges.
Okay.
This is how it is. The important point to take home is the recipients are not charged for the organs.
Okay.
Related.
Okay. So Ashtekar madam, are there any, the insurance company, do they cover any transplant costs?
If they are insured before getting into problem, liver problem or kidney problem, then yes, whatever was their cover will be. But if they are already having a problem, then it is not covered under the insurance.
Okay.
Cost of kidney transplant, as Dr. Borade said, is about 5 to 6 lakhs. For liver transplant, it goes around to 20 to 25 lakhs, and same for the heart transplant. So which is in our scenario where we don't have any security played by with the government. So in that case, and in government hospital, the liver transplant cost goes to 10 lakhs. So it is reduced. So it is very important that we do transplants more in government hospitals.
Okay.
Say for in Mumbai, there is no government hospital which does the heart transplant. Okay. But
okay.
Heart transplant in private hospitals. So how do we raise the funds? So mostly, as the facility is not available at the government hospitals, it is raised through the trusts and through yes, chief minister's funds and wherever, whatever available through crowdfunding like Impact Guru and all that.
Okay.
So you will see the heart transplants done in the private hospitals with very low socio-economic background patients who are coming from the rural village. So even if it is done in the private hospital, does not mean it is done only on the rich. So the amount is through the fundraising.
So exactly. So patient would be covered like any other patient covered under any other insurance scheme, provided that at the time of taking the insurance scheme, he was not having that pre-existing illness. So would I be correct in saying this?
Yes, yes. And for 4 years, some of them say that for 4 years, the symptoms should not arise. And
okay.
Or if he would have had those illness or organ failure, he would have explained or informed to the insurance company.
Insurance company at the time of paying the premium. Understood. Okay, so Dr. Borade, in quick, what are the end-stage diseases that can be cured by transplantation? Just a quick overview.
Yeah, so chronic kidney disease, end-stage kidney disease, end-stage liver disease, which is like chronic liver failure, cirrhosis of liver leading to chronic liver failure. There could be n number of causes of that. Cardiac failure, end-stage cardiac failure, biventricular failure, and COPD or interstitial lung disease causing complete, end-stage lung disease, where the patient is on oxygen and requirement of non-invasive ventilator is there. There are some conditions of intestinal transplant where, short bowel syndrome, for example, where patients have had ischemic bowel, and you have to resect a significant part of the bowel, and then patients are debilitated or quality of life is poor because of short bowel syndrome. And pancreas transplant. Now, pancreas transplant, the latest is lots of countries, and even in India, we are doing for diabetic patients. Very important to know, but the patient selection has to be very selected. And not all diabetic patients can go ahead and get the pancreatic transplant. Again, chronic pancreatitis again can be an indication. So these are the broad kind of indications.
Wonderful. So Ashtekar madam, what is the average waiting list for the organ transplant, and how long generally one has to wait?
Actually, I have already informed in my first session that 5,000 patients for kidney and 1,000.
No, but generally, what is the waiting period for people?
Yes, I'm coming to that. For kidney, it is 4 to 5 years, and for liver, it's around 6 to 7 years.
Okay. So it's a long waiting period. So is it possible for any influential people to jump the list?
No. This is Bhatte madam is smiling, and she knows as a Roto advisory committee member that the list is followed and
absolutely
as per the government guidelines and the score, and there is no one person sitting there and taking a decision. It's a score system developed by the government.
Yes,
the computer, and the system decides, not the person. And there has been no deviation, and we all know Vilasrao Deshmukh ji being a minister, that
yes, he could not
could not get the
yes, absolutely.
What more can explain the transparency of the system?
Absolutely. No, why this question is very, very important, because when it comes to the minds of ordinary people, or the common people, rather, even in the minds of some doctors, that these things are very easy to get it done, but it is very, very important to understand that the registry is maintained and there is a scoring system which is developed, and it is only based on the scoring system wherein the computer will generate who will get the kidney based on certain criteria which will match the organ. I think Dr. Borade can shed a bit more light on that later. Madam, can you just, I have already asked this question. I think Dr. Akash Shukla has already explained about the Roto-Soto registry, and Dr. Borade has also spoken a bit about protocol for organ distribution, but just a small brief about how the organs are matched Dr. Borade, you can also enumerate how the organs are matched and how the organs are distributed in very, very brief. Suppose the organ is available. There is a deceased donor somewhere where organs are available.
See, the hospitals who have done the apnea test and has got the oral consent, it is mandatory to inform them the local coordination committee established by the government. In Maharashtra and Mumbai, it is we have 4 ZTCs, Mumbai, Pune, Nagpur, Aurangabad. So whatever region you zone you belong to, you have to inform. So they know that there is a donor and the apnea is done. The distribution starts only after first apnea and after the oral consent has been received. Then this message, it generally happens with the help of the WhatsApp technology. There are groups where first the committee members of the ZTCC will decide whether these organs can be used, because we get marginal organs too. So after taking okay from the committee, then particular organ will be given. The hospitals whose patients are there up on the list will be informed with the name of the patient. One kidney will go to the hospital where their donor is, if it's a transplant hospital. Both the kidney will go to the city waiting list. And even if when it is given to the patients who are on the transplant hospital, it's not a hospital which decides. Again, the name appears in the computer. So we will tell the hospital. So suppose say there is a donor in a KM hospital will be very clearly informed by the ZTCC that this kidney, that is a donor kidney, is going to your hospital for number 1, number 2, number 3, number 5. And they have to say that we are accepting for number 1. If they're not accepting, then they have to give reason in writing through message, and which will be recorded. Now we have also developed the app for that. So everything is computerized. So nobody can say that I was not contacted or whatever. So all these responses are registered, and one kidney will go to them. For liver, the liver will first go to the donor hospital, then to the city waiting list. Same for the heart. And if the donor is not in the transplant hospital, then the organs will go to city waiting list. So that is how by principle it is distributed to the same blood group, then to the compatible blood group on the and then if there is nobody on these principles for that zone, then the organs are offered to the state, that is SOTO. Then SOTO will decide which ZTCC it will go to, that it will be going to the across, like from Mumbai to Pune, Pune to Nagpur, Nagpur to Aurangabad. And if not that, then to the region, that is our ROTO region has 5 states, that is Chhattisgarh, Goa, Gujarat, Madhya Pradesh, Maharashtra, and Union Territory of Diu Daman. Now there is only one hospital in Diu Daman. They are not doing transplant, but others are doing kidney and liver transplant. Gujarat is doing heart, lung as well. So accordingly, the organs will be distributed across the region in the middle of the night. This is all done immediately.
Yes.
First of all, even 1 minute delay from our side can lead to 1 hour delay there.
Absolutely.
So we cannot keep any gap, and there is a whole team working in the middle of the night to reach the organ in time, and the heart has to reach within 5 to 6 hours. So we have to even plan if it is going across the city, the plane timing, the charter plane timing, and accordingly we coordinate in the middle of the
Yes, we all have seen the green corridors being created. Yes,
and
absolutely.
then at ROTO level, if it's not somebody, so you will very commonly see organs coming from Chennai to Mumbai, Mumbai to even Calcutta. But madam, I also want to talk about one more tissue, I may say hand, which can be retrieved as an organ.
Okay.
Because it can be retrieved only after brain death.
Okay.
Hand transplants we have done, and we have shared hands across the state. So I just want to share, because hand is something upcoming that.
Yes, I think, madam, you have really elaborately explained it well, that it will first go to the hospital where the donor is from. If not hospital, to the city. If not city, to the state, different parts of the state. If not state, to the region. And if not region, to the entire country, wherever the patient requires transplant. So I think you could not have made it more clearer, and the process is very much in place. The system is very much in place, and it's not like haphazardly it is distributed or anybody can get it out of the blue. So yes, it is a very wonderful system, and all we need to do is get in tune with it and understand it well how the system works. Okay, so madam, my next question is that does the donor really, or rather the transplant recipient, whoever is looking forward for a transplant, do they have to be ready? I think it's already made very clear. They have to be ready at any time, given day or night. The call may come anytime. But my question is that if there is such a call, is it always that they get the organ, or even after informing, there may be some change of plans, and you know that giving the organ to that person may get cancelled at the last moment?
Depends on medical reason. It has happened. It has happened very rarely, but it happens that they get admitted, and sometimes now in COVID period, the recipients after all the workup has come up COVID positive. Then it has to go to the next patient. Or sometimes we contact number 1 and he has fever, so he's not fit for transplant, so we have to go to number 2. Sometimes for non-medical reason, like there is a beti ki shadi hai aaj mere, so I can't come. So this kind of a genuine reasons, yes, it goes to the next person. But there is something like when we do the whole process, there is something final organ allocation message. After that, we have hardly seen that the organ going to the next person.
Okay, okay.
Because of the cross match, because that takes 6 hours, and we sent 3 patients for the cross match to for one. So for donor hospital kidney and for city waiting list kidney, total 6 patients go for cross match. So in spite of that, recently we experienced, I think we have experienced this once in 10-20 years, that all the 6 patients could not come, and we had to go ahead. But
okay, okay. So madam, one is my next question is that can a person who is on the transplant list, can they know where on the waiting list they are?
of course, yes. And this is generally done by ZTCC, but we do not accept calls directly to the ZTCC or SOTO route office. There is a communication system established from a hospital to ZTCC to SOTO to route. So if anything hospital wants to say, it will go to SOTO. So very clearly ZTCC sends the list of the patient and with their rank to the hospital. So we convey that your hospital coordinator will tell you what is your rank. And
okay.
Also sometimes change because of some marks given for donor age. So, there can be questions which can be explained very scientifically and very correctly.
And what if a donor wants to know, the family of the donor wants to know where the organs have gone? Do they come to know?
We do not encourage this, madam, because this can lead to problems.
Emotional, yes.
Problems, emotional blackmails, and so it is not encouraged anywhere.
Agreed, agreed. So madam, now my questions are very much related to the pledging of the organs that we see so rampantly around. So we will just move on to that.
Bhate madam can answer this.
Yes. So madam, I would just request you, Bhate madam, to please answer. What happens when someone pledges? It is just enough to fill a form and have a donor card from the NGOs. There are so many NGOs just saying that please donate, pledge for the donation. So is it enough to just fill a pledge form and have a donation card from them?
One thing is, it is enough. And you can have more than 1, 2, 3 donor cards. That's okay. Secondly, even if you fill so many pledge forms and so many cards you have kept it in your cupboard, you have kept it somewhere, and your family doesn't know, then it's no use. Even if you're not filled even single pledge form and you do not have a donor card, but if your relatives decide after my death that, okay, I want to do this thing because it is a brainstem death, I would like to donate the organs, then they are free. They can do it. So it
okay.
is,
Okay. So what about the underage patients and those who are, very senior in age? So what about them? Are there any different, requirements?
Now, pledging can be done only after 18 years. So it can't be done earlier. But retrieval, as per the law, the age is not a bar. What is bar is how whether organ is working or not. So pledging doesn't happen. But there are people who have donated their 1-year-old, 3-year-old, 2-year-old children.
Yes, yes. So as you rightly said, it is the right of the family to take a decision in case of any unfortunate event. It is the family who takes a call, whether the patient or rather the person himself or herself has taken that call or no. Okay, my next question is to Dr. Borade. What if a person himself is an organ recipient? Can he or she be a donor? Because they are going to be on lifelong immunosuppressant. So can they, if they wish to donate that organ again, in case of they being brain dead at one point in time, they feel that, you know, after me, maybe this organ should come in use for somebody else. So can they think of doing that?
Yes, definitely they can do. So immunosuppression doesn't really interfere in organ donation. So if the organ is in the working condition, a good condition, they can donate that organ. Suppose if a person is had a kidney transplant, and if the kidneys are working very well, and this patient becomes a brain dead, and he agrees to donate after brain death, then definitely no issue with it.
Okay. So can someone with a pre-existing medical illness comorbidities be a donor?
Yes, I mean, as long as it's the same principle applies, you know, as long as it's not affecting that organ and that organ is not dysfunctional. Of course, failure means you need a transplant, but if that organ is not dysfunctional, you can donate such an organ. So for example, in the past, we have come across several such patients where, and so many brain dead patients, you know, we cannot donate kidneys or the lungs or the heart because they had ischemic heart disease or COPD or CKD, but their liver is fine. So and if such patient becomes brain dead, then they can go ahead and do the liver transplant. So pre-existing illness is not a contraindication to donate the organs. If the organs and whichever organs are in functional state, when one becomes a brain dead and decides to donate, they can donate, definitely.
Yes. So what is important is to know that have the will to donate organs and leave it up to the doctors to decide whether that organ can be retrieved and be used or not. So everybody, anybody and everybody can opt for organ donation. So that is the basic, I think, take-home message over here. My next question to Dr. Bhosle, does organ or tissue removal affect cremation or burial arrangements? Dr. Bhosle? Okay, we'll take the next question.
It does not affect.
It doesn't affect.
It doesn't affect. Okay. So, madam, are there any religious, Dr. Bhate or Ashtekar, madam, anyone can answer, are there any religious, blocks, mind blocks to, this organ donation? Does any religion say that organs should not be donated?
No, actually, no religion says that, because religions are for spreading love. And no religion in the world has said that organ donation. It's actually the responsibility of us to create awareness. If somebody is feeling that no, this religion does not do it, it is our failure, because we have to create awareness. That is most important.
Absolutely, because most of the relatives would like to see that the organ of their loved one lives in somebody else after the body is either going to be buried or it is to be turned into ashes. So emotionally speaking, generally the relatives would take a decision if counseled properly and if explained in a proper manner that, even after the death of the body, their loved one will be living in somebody else and will be giving life to somebody else. So they would opt for an organ donation process most of the times. Okay. So Dr. Borade, can someone who has been rejected for blood donation anytime can be an organ donor?
Depends. Again, it depends on why they have been, rejected for the blood donation. For example, blood donation, they might have been rejected for just a history of fever in a preceding week's time. But that doesn't mean that you cannot donate your organs ever. If one of your family members require it, or if you after your death. So it really depends on the indication why you declined the blood donation. So for example, if you're having any leukemia, and that's why you've not been accepted for the blood donation, then you can't donate the organs as well. So these are the important things to understand.
Okay. So Ashtekar madam or even Bhate madam, if anybody has decided to pledge before, or rather my one question prior to that is that any blood donation or body donation pledged for, organ donation pledged for. So basically can, does that pledge, does it have to be registered with Noto Soto every time? I mean, going onto the website by the organizations who are taking these pledge forms.
I feel yes, it's not mandatory or something, but yes, because that gives the database of how many people are actually registering. And that is what the Ministry of Family and Health Welfare has now announced, Azadi Ka Amrit Mahotsav, one of the thing is that getting more and more pledge form, which will be helpful. And I think this is the time, because if we collect the pledges and keep in our office, then it doesn't make any sense. So it's better if there is a national registry. We should submit this pledge form to the registry. And we forward it. Suppose say some NGOs wants to collect, so they can collect. They have to, we'll prefer that they have it in a format which is given by the law, because form number 7 of the law is very clearly a kind of pledge form. It is how in that format only, because the law has given us the format. So use this format. You can put your organization's name, number, whatever you want, but also put the name and numbers of the organizations actively working by the government, like ZTCC number, Roto-Soto number, along with the NGO numbers, whichever, or maybe suppose IMA wants to have a form, can have the form number 7 printed with the IMA logo and the numbers of IMA and numbers of ZTCC, Roto-Soto. So that can be done, but it is better these forms are submitted. If not forms, the Excel sheets. Now we have some organizations like Jivan Vidya Mission, who is a philosophical and spiritual organization, which has given us around 20,000 pledges. So we have sent it to Delhi. They have not given us the physical forms. They have given us on the Excel sheet and kept the scan copy of the forms, or can give the physical forms. But I think this data goes to the registry is very, very important, so that we know how many in India wants to really donate.
But does that really help when it comes to that person going probably on ventilator and, they are...
It helps in a way that the family is already aware, because the 2 witnesses required on the form is close family members. So many times I've seen NGOs we should not work for the numbers. That's why that format is important. So I may collect 5 forms, but if I don't take signature of the close relative, if I don't inform the close relative, it just becomes the number. So it is not mandatory at the time of donation, but definitely helps the donation. So someone who has not even filled a form can aram se donate if the close relative give the signature. So forms are not required for actual donation.
Okay. And what if someone has pledged before and say probably on Noto-Soto website, and then they want to unpledge? So can they do that?
Yes, they can do that. We have got such requests. So we have, and the important thing is they just tell their close relatives that I had filled this form, write on a piece of paper also that, I don't want to donate, and finish it off, because it is they who are going to sign. Suppose even if I have signed a form, it's registered, and they say, no, it's not going to happen. So the relatives can be just simply conveyed to the close relative and the work is done.
Yes. So what is important is for the relatives, the close relatives, to know that you have that wish and will of donating the body, because that is what is going to create actual donors, and not just your wish of, donating the organ. Okay, so my next question to Dr. Bhosle, I think this is the second last question that we have, that somebody has died at home, maybe because of natural causes, but because they have died at home, the doctors are not willing to give death certificates. I think you've already answered this question, but without the death certificate, would such bodies be accepted for body donation?
No. Death certificate is mandatory, madam. Cause of death, rather. We should, I think, high time we start using the word cause of death as doctors, and because cause of death and death certificate, basically what happens, even relatives, they are confused. Cause of death is normally we call it as death certificate only, but unless cause of death is there, we cannot accept.
We cannot accept. Agree.
Yeah. So many times, madam, police NOC is also required, because if no doctor is giving a cause of death, means there is some foul play. So then, yeah, we have to think of the police NOC. Yeah.
Okay. So there's one question which I can see in the chat box, is that we are approved as a retrieval center. Who's responsible for HLA typing and matching? Anybody can take that question. There is Dr. Suvarna Chahankar who's saying that we are approved as a retrieval center, but who's responsible for HLA typing and matching?
It will be the recipient hospital, and ZTCC will be responsible for HLA typing and matching. A retrieval center's role will be only to provide the place, and it is more with the retrieval. And HLA typing is with the listing and the distribution. So I think the retrieval center should not be worried, because they just have to inform the ZTCC, the cross match and everything will be arranged by them. And the retrieval team also will come to the center for it.
Okay, so I think that covers most of the aspects regarding the organ donation and transplant. If anybody's got any question which is besides what has been already asked or covered by the speakers, you may please raise your hand, or we will go towards the take-home message by each of the speakers for today's session. So is there any question which anybody wants to ask? You can just raise hands. So till then, we will go to our first speaker for the take-home message. Dr. Borade, could you please give your take-home message? Please unmute yourself.
Sorry, 1 second. So as I had put it on my slide as well, it's a noble cause. Organ donation is a noble cause. One person can save 8 lives, improve the quality of life for hundreds of patients by doing the tissue donation. Please spread awareness, because you are now aware of how organ donation. I think Dr. Pathak, you covered the topic and all the questions brilliantly, and every single question was so important. Clear your misunderstandings and myths amongst your family members. Start with your family members and then your friend circle. And remember this again, what I said was, we are the second most populated country in the world. And if every person thinks like, after brain death, I want to donate my family members' organs, just imagine, I wouldn't have thought there would be 5 lakh people waiting, as Dr. Astakar madam said, for the organ donation. So just remember that, very important.
Absolutely. So wonderfully summed up. Before I move on to Dr. Bhosle for his take-home message, we have got Dr. Rajnikant Wankhede. He wants to ask a question. Please unmute yourself. Dr. Rajnikant Wankhede, please unmute yourself. Okay, we move on to Dr. Kishore. Yeah, Dr. Kishore Londe, please unmute yourself.
Yeah, okay, so Dr. Kishore Londe here.
Yeah.
Okay, so, and I want to ask that, okay, on the donated body, okay, can we do some preclinical experiments if you want to do any preclinical experiments on that, like some imaging or some vascular stuff only for the academic purpose? So what are the rules and regulations for that?
Sir, you are asking as in medical colleges, or you are asking as in by the doctor who's giving the certificate? I mean, in what capacity are you asking this question?
Okay. So these experiments at the medical college level, plus I'm advisor for some medical device industries. Okay, and they want to do some experiments on this cadaver, vascular experiments or some cadaver experiments. And medical college also want to do, because I am involved with Divyapathik and Symbiosis, where we want to do our cadaver studies. So what are the rules and regulations for that?
Dr. Bhosle, could you take that up?
Yeah. The thing is that this is allowed research, because the body itself is being donated for research. So it is allowed. Only thing is, we should avoid taking cadavers out of the medical colleges, even at a neutral setting. That because then something, it is very illegal to take the body or body parts out of the medical school. That's what I would suggest. Okay, so whatever you want to conduct in collaboration, everything is good, but not outside a medical college. Okay, because there are some rules and regulations that cadaver cannot be taken out of the medical college once it is donated there.
But with in-house permission of the ethical committee of the medical college?
No, normally for cadavers, we just inform that this study is on cadavers, but ethics committee permission is not mandatory. But still, we just inform them.
Okay.
Because expect that the whole body was being donated for that cause, madam, for medical research. So any research is okay on that. Yeah?
Okay. I think Dr. Londe, that answers your question.
Yes. It's very important that you have told that no need for permission. It's just information about you.
Yes. Okay.
Thank you.
Yeah. So Dr. Bhosle, your take-home message, please, for the listeners.
Yeah. So my take-home message is, now body donation is the only way by which the medical colleges are going to receive bodies. So please spread the word around, create awareness. Otherwise, we'll be having doctors who have become doctor without dissecting. We'll be having surgeons who have become surgeons without learning anatomy. Okay, so yes, it's a very grave issue which actually current doctors are not aware of, that right now 80% bodies we are receiving only from donation, rather I would say 100%. No roadside bodies, no TB hospital bodies, nothing. Medical college is totally dependent on body donation now. So, and you all as doctors know the importance of dissection. Without dissection, surgery,
There are no doctors.
ENT, ophthalm, and no doctor, I would say. Yeah, thank you so much.
Absolutely.
Yeah.
So well said, Dr. Bhosle. It was wonderful message. Rather, I think each and everyone would realize, the importance of body donation in addition to the organ donation process. I come to Bhate, madam. Madam, your take-home message to the listeners, please.
Yeah, my main take-home message is everybody can inform others, because if we learn whatever we learn today, we have to inform others. Unless we do that, and the entire country is covered, entire population is covered, and everybody knows, then it is possible that we will not have a big waiting list. You can reduce the waiting list, and you can tell that to yourself that I can do this. So even a school student, a teacher, anybody can do this. So spreading it and creating more and more awareness is important.
Absolutely, madam. And that is why the name of today's session is Train the Trainers. So you all are expected to become the trainers, that you are expected to become the ambassadors of, spreading the word around for the body donation and the organ donation, because I think the majority of you will have your doubts cleared and your ideas cleared about the body and the organ donation. So thank you so much, Bhate madam, for that message. And I now invite Mrs. Sujata Ashtekar madam for her take-home message.
Just tell your patients whenever you take home this, and also for your patients, that brain death is death, because brain death is not well accepted in our Indian situation. So whenever they contact you, tell them, yes, brain death is death. Secondly, don't take your organs to heaven. God knows they are needed here. Thank you.
Yes, it is absolutely correct. Rather than allowing it to turn to ashes or letting it be, buried in the ground and meet with the dust, let us see to it that more and more patients get a chance to live with the organs which are donated by our loved ones. So thank you, madam. And with this, we come to the end of this session. And I really cannot, thank every speaker. You all have been so wonderful and so very elaborate. We have already e-felicitated all our speakers. And with this, I take the opportunity to e-felicitate Ashtekar, madam.
Madam, one second.
Yes.
1 second. There was a issue that
Sir, your voice is
on cadavers.
Sir, you are not audible. Yeah, can you repeat it again?
Yeah. There was a doubt raised that whether ethics committee permission is needed for you need to take permission. We take the permission, definitely. I think. Okay, at least we should inform them. Yeah.
Sir, you were not audible. Can you just repeat it again?
I just wanted to inform that regarding cadaveric research,
okay,
we should be informing the ethics committee. And if they insist on taking permission, we should take the permission also. Okay, I just wanted to make it clear.
Okay. So either they have to inform in writing, or if their medical college has this policy of taking permission of taking ethics committee clearance, they should do it.
Yes.
Okay. Yes. So that is understood well. Okay. So with this, we have e-felicitated all our speakers. I take this opportunity to e-felicitate Mrs. Sujata Ashtekar, madam, who has been, of utmost importance in organizing this particular seminar. So, madam, with this, through IMA Maharashtra State, we present you the certificate of appreciation for your excellent coordination and cooperation in organizing and seeing this, that this program sees the light of the day. Organizing this organ donation awareness program, Train the Trainers for medical professionals by IMA Maharashtra State in association with Roto Soto. So thank you so much. It has been a pleasure, to see all of you attending this session till the end. I'm having 125 people. I think that in itself speaks a lot about the interest that people have in this particular. And I'm sure organ donation is something which is very close to many people's heart. Only thing is they do not know how to go about it. So with this, I invite our advisor, Dr. Arun Halve sir, for please giving his remarks. Our another advisor, Dr. Anil Suchak sir, has not been, he's not been able to remain present because of some other commitment. So I request Dr. Arun Halve sir to give his remarks. After this, we will be having announcements of our next program, next 2 programs which are in the pipeline. Sir, please unmute yourself. Sir, चला sir, बोला sir. Sir, आवाज नहीं येते तुमचा. Sir, you are not audible. हाँ बोला सर, अनम्यूट करा. हाँ सर, आवाज नहीं येते. सर can't hear you. तुम्ही जस्ट एक हेल्प घेऊन सर हे सॉर्ट करा, तोपर्यंत मी पुढची अनाउन्समेंट करते सर. हॅलो. Okay, I think his internet is hung. Okay, so till then I'll make announcement for the next 2 programs. Just give me a minute. So our next program is on 15th of March, that is Train the Saviors, and target audience is any of the MBBS and above. Anybody can attend, but the target audience definitely would be people who are used to working in the ICU or who intend to work in ICU. So it will be intensivist, people belonging to internal medicine, anesthesiologists, chest physicians and others, or MBBS doctors who are working as ICU residents. And we plan to cover more in detail about identification of potential brain dead donors, brain dead donor maintenance, counseling process, and the THOA Act. And the session after that is on 19th of April from 3 p.m. to 6 p.m. That is training of the hospitals, and the target audience is going to be hospital owners to train regarding requirements for making hospitals into potential organ retrieval centers. The topics that would be roughly covered are: what are the organ retrieval centers, specifications for becoming organ retrieval centers, infrastructural, administrative and manpower requirements, and how to apply and comply with the various norms. So with this, Halve sir, are you able to unmute yourself? Sir, you are not yet audible. नहीं सर, आवाज नहीं येतोय. हलवे सर, नहीं येते सर, आवाज नहीं येते. सर, you are unmuted but you are not audible. आवाज येत नाहीये तुमचा. तुम्ही कानाचा ते इयरफोन्स लावून नाही ठेवलेले आहे ना सर? इयरफोन्स लावलेले आहेत पण कानात नाही लावले असं नाही ना? नाही, आवाज नाही येते सर. We can't hear. Okay. So, sir, in that case, we'll have to move forward. So with this, we come to the end of this session, and it is my pleasure and privilege to thank everybody who has been a part of this wonderful program. I thank Roto Soto Director, Dr. Sujata Patwardhan Madam, for agreeing to take up this particular program and for agreeing to take up the various series of lectures that I have just enumerated and which we will be taking in succession. Thank you, Ashtekar Madam, for the entire coordination with the Roto Soto and coordination with the speakers. I thank all the speakers for today. Joint Director Roto Soto, Dr. Akash Shukla, Dr. Yuvraj Bhosle, Dr. Prashant Borade, Dr. Kamakshi Bhate, and of course, Ashtekar Madam herself, who took part as a panelist. Thank you everyone for the elaborate sessions that you have taken. I thank IMA Maharashtra State President Dr. Suhas Pingle sir and Honorary Secretary Dr. Mangesh Patel sir for helping us to organize this program and giving us permission to organize this program. I thank our advisors Dr. Arun Halbe sir and Dr. Anil Suchak sir for all the guidance and the advice. I thank my team of IMA Maharashtra State Organ Donation Committee, Dr. Prashant Devre, who's the convener, and the members, Dr. Niti Upasni, Dr. Vijay Shivpuje, Dr. Sheetal Mahajani, and Dr. Vaishali Khandait for chairing the sessions wonderfully well. And of course, it would not have been possible had all of you not participated. So our sincere thanks to all the participants for today's program. And I'm sure all of you will, spread the message of organ donation awareness. So with this, we will take your leave and we'll be signing off for this particular program. And soon we will be coming out with announcements for our next program. Halbe sir, are you able to unmute yourself for a final remark? Sir, काहीच ऐकू नाही येते. So we would appreciate your feedbacks on the session, any suggestions, anything that you would like to have added, deleted, any content which you thought was good, any content which you thought could have been replaced, should be replaced in the next session. We would welcome all your remarks on 9819018000, or you can write to us on the same mail ID from which you have received the Zoom link, that is the organdonationcommittee.imams@gmail.com. So with this, we sign off today's session and thank you everyone for being here. Thank you.
Thank you.